We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
Così uli di sombranza e zuita saluda antes di niga radzaudzan malak estrezas durante todo a nogi distancia gumugubugi palu zangiman malak guafi ikonung nasugi airi prebatula noci nai banderata gaigi pues atan fanny bandera kau esta pagua pumalapa giluk tanu man libri sentami ti man ko badi.
Viva in la lotta, fanno
let's go. Good morning, Guam. Good morning. Good morning. Good morning on you. Welcome to the link on the Breeze 93.9. Good morning, Sabrina.
Good morning.
It is Wednesday, the 9th day of September, 6/17, and it's all proudly brought to you by First Hawaiian Bank, Cabo Enterprises, and IC&E on what looks like a beautiful, beautiful Wednesday morning. There's something you can appreciate. Take a look outside. We're living in paradise. Yep, it's a troubled world, but at the end of the day, and at the beginning of the day, we get to wake up in what I think is the most beautiful place in all of the land.
There, we're giving you a shot of sun. Look at that.
Yeah, Joe's are outside. Okay, we don't have the best sunrise view here in Harmon.
Still beautiful.
It's still beautiful. Coming to you from the village where restaurants are shut down for rodent. How ironic was that, Bree? We had Division of Environmental Health out of Public Health on the show yesterday.
Yeah.
Talking about inspections, and then they inspected Holmai here in Harmon.
That inspection was on September 2nd.
Okay, so
right?
it was
But the release came out
a week later, right?
a couple days later. Yeah.
And the two big infractions, I mean, you know, what a 1-2 punch. Rodent infestation and wastewater backup. Yum! Yum, yum, yum. That's why that lumpia is so tasty. 6:19. How's your breakfast? Good morning. We have a jam-packed show for you guys.
A little rodent infestation didn't hurt nobody.
That's gonna put, like Grandma said, that's gonna boost your immunity.
That's protein.
It's protein, right, Jay? All right. Haven't you guys seen those videos where they cook the rats?
No.
Okay. Good morning, Sabrina.
Good morning.
Guys, we have a jam-packed show for you guys. We've got they're doing a grief seminar, so we're going to talk with some ladies who are organizing talking about grief recovery, which is, I think, a daily process for everybody living under this pandemic. Of course, they had a big meeting with the Physicians Advisory Group last night, so we'll have Dr. Hoa on to talk about that. And the Medical Director for Public Health, Dr. Jana Maglotnia, confirmed with Annette Uggan, who's the Public Health Contact Tracing Head. So they'll be on around 7:20, 8:15. We'll break bread with John Fernandez, the GDOE Superintendent. And then 8:45, we'll switch gears a little bit and check out the private schools with Dr. Juan Flores and Jeremy Zaitchek of Harvest Christian. And also this morning, we plan to, if his condition permits, talk with one of our friends, someone who has rubbed elbows with our KUAM family over the years. Sadly, he contracted COVID, and so we'll kind of talk with him and get his side of it. And then, even with no face-to-face learning, high school students continue to do big things on Guam. We'll talk with some of these public policy interns at the Guam legislature and find out what that experience was like, interning at the legislature during a pandemic. 6:21, so all of that is coming up. Good morning again, Bree.
Good morning.
You want to just jump into the news?
Yes, we
Let's
can do
go.
that.
We're clocked in.
All right, we're clocked in.
Okay,
we're ready to go.
Okay, we're going. 6:21. Good morning, Guam. Again, it's the link on the Breeze 93.9. We are KUAM FM in Hagåtña, but we're actually in Harmon. It's weird how that works. I don't know.
It is what it is.
Yeah, it is what it is. Let's just do news from the KUAM news team. Sabrina Salas-Mantanani, good morning.
Hafide, good morning, everybody. Guam recorded its 19th COVID-related death, a 64-year-old woman with comorbidities compounded by the coronavirus. According to the Joint Information Center, she tested positive for the virus on August 25th at Guam Regional Medical City and was transported to GMH on the same day. She passed away just before 3 o'clock Tuesday afternoon. As for the latest numbers, out of 795 samples, 43 returned positive for COVID. This brings Guam COVID case count to 1,713. 743 are active cases, while 951 people are in recovery. All 10 Guam Customs employees assigned to the agency's field office at the Port Authority have either been placed on isolation or on quarantine. This after half of them, or 5, tested positive for COVID. Customs assigned other administrative support staff and officers to the cover down. The customs office at the port, meanwhile, has been sanitized and disinfected. Contact tracing is underway. Meanwhile, over at the port, a 6th employee there tested positive for the virus. 4 others were identified as close contact and were tested. 2 returned negative. The other 2 results are pending. We should add the port has its own contact tracing team, who are all now certified contact tracers through the Association of State and Territorial Health Officials. The Navy confirms that sailors and civilian mariners aboard the USS Frank Cable in Apra Harbor have tested positive for COVID-19. A statement from the Pacific Fleet Submarine Force said there's been no impact to the mission, but did not say how many were infected. Spokesperson Commander Cindy Field said, if someone tests positive, they are placed in isolation and close contacts have been identified and are in quarantine. Our top priority is the safety of our crew, sailors, civilian mariners, families, and the community. We live and work here in the community, which has seen positive COVID-19 cases. Tomorrow, the governor's office, alongside Public Health and the Office of Technology, will be launching the Guam COVID Alert app, designed specifically to aid in contact tracing. According to Public Health spokesperson Janela Carrera, the app will give you a notification if you've been exposed to somebody who's been diagnosed with COVID. The app uses Bluetooth to notify you if you had contact with someone who tested positive. The app also keeps your information safe by exchanging randomized Bluetooth keys that change every 10 to 20 minutes, so your personal data and location remain private. A press conference is scheduled again for Thursday. In national news, the search for a coronavirus vaccine has taken center stage in the presidential election. Skylar Henry has more details from the White House.
President Trump will hold a campaign rally in North Carolina this evening, where the local Republican leader is asking the president to comply with state orders and wear a face mask.
He'll be tested this morning. I was already tested this morning. And when we talk about actually wearing a mask, it's really for the protection of others. So I don't see a need for the president to do that.
The coronavirus pandemic continues to dominate presidential politics, with a back and forth about a future vaccine over Labor Day.
I want full transparency on the vaccine.
With me, it's the faster the better.
President Trump continues to tie the timeline for a vaccine to November 3rd, Election Day.
We're going to have a vaccine very soon, maybe even before a very special date. You know what date I'm talking about.
Democratic nominee Joe Biden says linking the vaccine to the election could hurt its chances for success.
He said so many things that aren't true. I'm worried if we do have a really good vaccine, people are going to be reluctant to take it. And so he's undermining public confidence.
President Trump says it's Biden and his running mate Kamala Harris who are undermining public confidence about the vaccine.
Contrary to all of the lies, the vaccine, that they're politicalized. They'll say anything. And it's so dangerous for our country what they say. But the vaccine will be very safe and very effective.
Biden says he prays for a vaccine soon.
If I could get a vaccine tomorrow, I'd do it. If it cost me the election, I'd do it. We need a vaccine. We need it now. 9 pharmaceutical manufacturers working on a vaccine issued a joint statement saying they will only submit a vaccine for approval if it's proven safe and effective. Skylar Henry, CBS News, the White House.
Back here at home, the governor's announcement last week of $35.6 million surplus in fiscal year 2019 as Senator Joe Augustine asking, show me the money. The appropriations chairman says he wants the administration to explain exactly where the extra money came from and where it's going. Nestor Lecanto reports.
St. Augustine says all he's asking for, especially in this tight fiscal climate, is a clear understanding of what the surplus will be spent on. The governor in a news conference last week said she plans to use it to pay down the deficit and prior year obligations.
You know what they say, right? I trust you, but I will want to verify it. That's all I ask for. It's just verification of what did you pay down? What were the deficit payables that you had to pay off? You can't tell the people of Guam you paid something down and you don't have a list. There's got to be a list. $35.6 million is a lot of money.
Speaking of money, the governor has until Friday to take action on the fiscal year 2021 budget bill passed by senators last Monday. Since then, the administration has sent out multiple press clips pointing out specific concerns about spending shortfalls. San Augustine won't speculate on the governor's intentions, but what if she doesn't sign it?
What is her justification for the veto? Then we can move from there. And if she happens to, if by luck, that we get a revised budget, a new budget from her, and that it's workable, then we'll take a look at that one. And then I've got to sit down with all my colleagues and says, okay, here's the new budget. What do you think, on how comfortable are you with it?
What is certain is that a new budget must be passed by the start of the new fiscal year on October 1st. Otherwise, San Augustine says, the previous year's much more expensive pre-pandemic budget goes back into effect.
I honestly believe my colleagues are not ready to go that route. So one way or the other, there will be a budget in our hand.
For Guam's News Network, I'm Nestor Lecanto.
Public Health's Division of Environmental Health suspended operations at Ho'omai Restaurant in Harmon until it addresses violations noted during an inspection conducted on September 2nd. Among the observations noted in the inspection report was the appearance of an active rodent infestation and wastewater backup in the kitchen, both of which constitute an imminent health hazard, according to inspectors. Guam Customs Director Ike Paredo back on the job. In July, he was placed on administrative leave after an alleged physical altercation with one of his subordinates. According to Adelup, GPD completed its investigation and Paredo returned to duty Tuesday. Because of an ongoing criminal complaint, the director is to have no contact with the female employee involved and others involved in the complaint. He was also ordered to fully cooperate with the Attorney General with the case. For more news, go to KUAM.com, and we'll be back with more on the link right after the break.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6
at 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Hafaday, my name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers of Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Good morning. Yeah, this is a cut from Live Local Fridays. I think the guy was either like a military spouse or stationed here. His name is Shannon Standeridge, and this is basically the white people version of Fried Chicken Affinitani.
Sounds good, though.
Yeah.
He's got a really great voice.
He sure does, Sabrina.
I thought it was some, like, national song.
Yeah, he's like, boy, we're going to get dinged by Facebook. Yeah, just
sounds
one of the
really
many.
country.
Okay,
Is he from Oklahoma?
Okay, stop the press. Jason Solis, everybody.
No, I just wanted to ask about that because, of course, you are from the great state of Oklahoma. But do you know how to sing the song Oklahoma?
No, I don't.
Oklahoma, where the wind goes whistling, where the whistling. Maybe you weren't in the play, but
No, I wasn't.
How savvy are you with your country music? Like, did you grow up listening to country, and when you were in college and?
No, not really. It's not something that I always listen to.
Yeah, it was. Come on.
Because I do, and even on the show, you guys in the comments, you guys have pointed this out.
Now I'm not going to be able to stop talking like this.
Yeah. Your accent, there's a small trace accent. I think you say y'all more than your accent comes out and everything. Every once in a while you'll say y'all, but like your accent comes out every once in a while.
Oh, really? Which one? Ghetto Brie or Country Brie?
That's okay. I'll leave that to the comments.
Yeah, it's a toss-up.
Let us know who you like better, Ghetto Brie or Country. I can't wait to see how this turns out.
Sabrina's like the walking magic 8-ball. You never know what you're going to get when she gets shaken up. 6:34, country music. Thanks for asking, Jay. My family would always play country music, especially when they were gathering around drinking, like the most depressing country songs. I didn't get it. They would sit around and listen to, She Stopped Loving Me Today and
Like some Garth Brooks.
Right. But I never really was into it until I got older, and now I'm older. I don't know if I just aged into it or something, but I like the country.
Okay,
I like the old stuff. I don't like the newfangled.
And most people know it's like, okay, you've got Taylor Swift started out in country and then went mainstream. There are a lot of musicians who have found greater success doing country music, like Darius Rucker from Hootie and the Blowfish.
Right.
Has won multiple Grammys now as a country artist. Aaron Lewis from Stained. Major metal guy. He does a cover of Rascal Flatts, What Hurts the Most.
Right.
Unbelievable ballad. It's insane. It's really, really good. That's actually one of your favorite country songs, right?
Excuse me?
What hurts the most
is when you're so close.
Oh, man.
Okay.
I hope our guests sing better than us.
Well, I found that stash of the Korean N95 masks, guys. It was in the filing cabinet somewhere, and right now I might have to play commercial and go change my mask because I'm getting that muffin face.
Those actually look pretty good. Like, it must be easier to talk with because when I was anchoring the news, I felt like I was gonna swallow, like my mask, like I was gonna gag on it because it felt like it was going inside my mouth. You know how it is when you anchor and it's like, it's already hot inside the studio and the lights are beaming down on you.
This is what I call the Donald Duck mask, though, because I feel like it's a duck, right? Whack,
what
whack.
did you? That's gonna say. What did you do when you put it on?
Whack, 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 whack.
I like it. I want to try it.
Yeah, well, there's a whole bunch in there, so please do. Hey, before we get into our next interview, we read that story about the customs director, Ike Pareto, who is back on the job.
Yeah.
Right? What the investigation was completed, or?
Yeah, GPD conducted an independent investigation, and that was the release that we got, that he was back to work yesterday.
Nice, yeah. So
it didn't give you the findings of the investigation. But
interesting,
hey, he's
yeah.
back to work.
They might have left out the meat of the sandwich. But I'd put it in the comments here. Do you guys see the Bureau of Women's Affairs statement condemning Ike Pareto? And then Rosemary Laguana, who's an avid Link listener. Thank you. Good morning, Rosemary. She said, "Can you read it out, please?" No, I can't because there is no statement from Bureau of Women's Affairs condemning the behavior of the customs director, Ike Pareto, who got into a shoving match allegedly with a female employee. There's no release. There's no release from the Bureau of Women's Affairs. So I can't read it out. I think it probably got stuck in the printer. Or maybe it was getting printed out and someone at Adlib was like, "You better not." I just think we got to be consistent. I've seen this in some chats where people have, obviously we gave Dr. Akamoto what he deserved. And I just feel like we just have to be consistent. And with this sitting director getting into a alleged shoving match with a female employee, I'm just not sure that it was adequately addressed by people. 6:37. Good morning, Bree.
Good morning.
Yeah, she's like, okay. I don't want to get ghetto, so.
By the way, an equal number of votes for Ghetto Brie and Country Brie at the moment.
Right, that's a tie. I think you bring ghetto and country at the same time. So we're going to bring on our next guest of the KUM News Zoom room again. We're doing the doctors. We got Dr. Hoa at 7:05 and Dr. Genny Pennington 7:20 with Annette Huggan of the Public Health Contact Tracing. We've got John Fernandez, the GDOE Superintendent, and a whole lot more coming up on the link. But we get started here. They're getting started this morning with this grief talk in the midst of a pandemic. This is it's a virtual seminar, a conference, and in our KUM News Zoom room, joining us bright and early this morning, we have Darlene Garcia and Michelle Sasamoto from the Grief Talk in the midst of a pandemic. Is it a seminar or a conference?
None. It's just a conversational platform.
Nice.
Giving permission to talk about loss, pain, grief, and the reality of what's happening right now to us on an emotional and a mental level. So yes, it's a safe space.
Nice.
I don't think Darlene. I can't hear Darlene.
Darlene.
Unmute.
Yeah.
There you go. I just got to say, I really appreciate that you guys are having this because I think we are all going through so much. Yeah, we can hear you, Darlene. We are all going through so much right now, and I think people need to have these sorts of conversations, and maybe even just having that voice of reason and just being able to cope with what's happening. So I really, really do appreciate you guys having this seminar.
And let's just get right into it and talk about the kind of grief that a lot of people are experiencing. Talking with a friend last night, right? So we had another COVID-19 death, and we've seen an increase since Friday. So a lot of people who don't necessarily know people who are dying of COVID are feeling that wave, right? And I think it's totally normal to feel these things. I mean, you got to have compassion. You got to have empathy for what these people and their families are going through. And we kind of carry that. I mean, I know I do. And we're carrying the grief of being in this months-long pandemic, which it just wears thin on everybody. And a lot of times I see that people don't realize how on edge they are, how affected they are. And I believe it's grief that we're all carrying around, all this unprocessed grief that we don't have the right context for yet because we're still smack dab in the middle of this, like you said, in the midst of this pandemic. So I don't expect a short answer, but how do people begin to kind of acknowledge and process this burden that I feel we're all carrying around?
Well, I think first they need to realize that everything that they're feeling is all normal and natural. And I believe that so much of what we learned about grief is teaching us that feeling a certain way is not normal or natural. It's actually unhealthy. And so when people get stuck in a place like that, then they tend to compartmentalize, they suppress, they numb, they self-medicate. And then that's when all of the bad things happen in our lives. And so, Grief Talk is our way of giving back to the community, helping people understand grief at a whole new level, providing a safe space for them to be able to come and either share their story, listen to other people's stories, know that they're not alone in this world, and then walk away with some tips to take care of themselves in the midst of this pandemic, because we know it's not going away anytime soon.
Absolutely. And I just want to say also, Chris and Bree, good morning.
Good morning.
Thank you so much again. I look forward to your shows. And Jason, hi, Jason. With grief, right, as Dar talked, the normal, natural reaction to a loss of any kind. And there's so many different losses that people are experiencing. Like, I know, for instance, for myself, there's loss of control. There's loss of safety and security. There's loss of even knowing, intellectually, like what the day is. And as silly as that may sound, when people ask me, what day is it? I'm like, it's today. And we get so caught up in these different losses. And like you said, the processing, how do we do that, right? First of all, is it normal, natural to feel so fearful, to feel so sad, to feel so confused, to feel so uncertain, to feel so ambiguous every single day? Yes, And I think people need to know that yes, it's part of it, and that everything that they're going through is exactly what should be happening. And the next part of it is taking the action steps, right? Knowing that we're feeling certain things, but now taking the action steps to not allow that to escalate, to do self-isolation, where people will choose to self-isolate. And I'm not talking quarantine, but, basically just like laying in bed and not wanting to wake up, not having that drive to do anything for the most part, withdrawing from friends and family as well. So we're real excited to just bring a whole different perspective. I don't want to take up too much, because I want to make sure Darlene has a lot to say too. But one of the things since the beginning of the pandemic, we were so focused on the pre-existing physical conditions, right, of people. We talk about that and how they're at higher risk for COVID and maybe even healing from the virus. But I also think about the pre-existing conditions on the emotional and mental level. People were going through relationship breakups at the time. People were going through divorces. There was deaths in the family. There was already financial hardships. And it seems like those became a secondary issue to the whole pandemic at its best right now. So we want to not forget about those pre-existing emotional and mental conditions as well.
I think also what seems to be important is the fact that, it is grief talk. And I think one of the important words in that is talk. And maybe letting out, you always tell people, hey, let it out. And it just, to me, this is kind of what it a part of it means, is that we need to talk about it. Don't hold it in, because I think that when you hold it in, it could lead to other sorts of conditions, whether it's your health. You know what I mean? Could you talk a little bit about that?
Right. Yeah. And honestly, that's why we're doing this, is because people don't feel like they have a safe space or an outlet to be able to talk. There aren't, enough people around them that understand maybe what they're going through. And that is one of the big myths of grief, is that, we have to grieve alone, or we have to be strong. And so when we're in the environment of, I'm around my entire family, my children, maybe my elderly parents, I don't want them to know that I'm scared about what's going to happen in the future, if we're going to be able to put food on the table or be able to pay our rent next month. These are all fears that people are having right now. And fear is one of the biggest emotions that we feel when we're grieving. And so to be able to come into a platform such as what we're going to be providing tonight on Guam, then it gives people an opportunity to be able to share. And if they don't share, because maybe they don't feel comfortable yet to share, at least they'll be able to come and listen to what other people have to say, and know that there's going to be a lot of relatable stories out there. And really, we're all in this together, right? It's also, September is also Suicide Awareness and Prevention Month, and I'll have Michelle talk a little bit more about that. But that is actually one of the reasons as well that we're doing this grief talk, is that we are in partnership with many of the organizations around the island that are doing things to be able to bring awareness and prevention out there about suicide. Because in the midst of a pandemic, that is one of the things that people sometimes feel that they have to resort to, because there doesn't seem like there's going to be an end to this anytime soon. And that can weigh really heavy on a lot of people, especially if they are the responsible parties in their family, to make sure that everything is going okay when they can't control a lot of what's going on. So I'll have Michelle talk a little bit more about our partnership with some of the organizations around the island.
And then if you could maybe fold in a little background about yourselves, in case people are watching and they're wondering, oh, are these ladies therapists, are they psychologists, what's their background, what gives them not the right to talk about grief, but I know a little bit about your backgrounds, and I think it's interesting for people to know.
Right. We are grief recovery specialists. We are not therapists. We are not counselors. We are not clinicians. We are certified to teach a method that helps people take action to heal their hearts. So everything that we do around grief recovery is all about the emotional impact that happens in our lives. And it does coincide with what happens physically and mentally in your body, but we focus so much more on the emotion. And we do that, number one, because emotions is one of the things that we most ignore. when we're going through some really tough times in our life. And so we've got an amazing method, and Michelle and I, both are widows, and that's actually how we came together in our relationship and building this friendship and this partnership around grief recovery. We first went through our own grieving experience, and then that's how we found the grief recovery method. And through this amazing tool, we went and got certified because we knew that the island didn't have anything close to what we offer. We definitely have many mental health professionals. We have a ton of respect for that community, but we're not mental health professionals. We are emotional health professionals. And I think that that's what sets us apart from everybody else. So I'll have Michelle speak on her behalf.
Yes. Yeah. And so, gosh, it was like four years ago. It seems so short, but it seems so long at the same time, right? Like the irony of that, and meeting Darlene. And, again, we always like to say we are creating a web of resources for everyone. There's no one size fits all, in terms of the types of services, the types of resources for an individual. And grief recovery is just added on to that list again. And what we want to do is we want to leverage, because, we have a wealth of resources on the island. As a mom, I need to know that. I have a kind of like a teenager transitioning into young adulthood. And I also work for the Guam Behavioral Health and Wellness Center as a program coordinator. So I run a lot of the federal grants programs to include suicide prevention and substance use prevention. But at the same time, not everybody needs mental health services, and not everybody needs certain things. So we want to just make sure that we have a variety of helps and supports that are out there. And again, it's to know what's there, to take our different resources and collaborate so that we can be allies. Because if someone comes through our program and it's not what they need, and we know that they may need something that's a little bit more specialized than what Darlene and I can offer, we are now able to refer that individual to the next level. And it's just like a whole cycle. So back to the resources, we have a wealth of resources. And I think the most disheartening thing for me is that these services exist on our island. And I don't know if the awareness is really, at the level where we need to make it be. But I really, truly believe that promotion of the services is very important. And again, Bree and Chris and Jason, your jobs are so important in really bringing those resources out to the community to be able to use. Because many times I hear people say, well, where do I go for help? Who's going to help me? Who's going to be able to take care of these situations? And you know what? It also is our due diligence, right? As brothers and sisters of the island, as the role that we play to know what's out there, because we never know if somebody is going to need that additional lifeline again because they're going through something. So that's kind of how we met. I started a widow women support group. Darlene walks in. We actually started, another person and I started it for the sake of Darlene, because she recently became a widow. And she sat in there for the first time and felt like, what is this? Because there are so many different experiences on the table, although we were all widows. And it's just a testament about how unique everyone's grief journey is, right? Darlene and I resonated with being a widow, but her grief journey at the time was so different from where I was at. I was already in a relationship. It had been several more years that my husband had passed since Dar. And when she came in, she knew that, gosh, there's got to be something else. And when she was the first one who decided to go to the grief recovery certification, not even looking to be certified, but just trying to look for answers. Like, am I ever going to just see a speck of light again, right, Dar? And so she goes and she comes back, and that whole transformation that I saw in just the next couple of months was amazing. She vowed that she was never going to come back to our support group, but she actually came back. And when I saw that, I realized, as a person that had been 4 years into my husband's death at the time that Darlene's husband died, I was like, whoa, Michelle, you are the helper so many times. You're always out there helping people. You haven't done the work on yourself yet. And hence why I decided to go out there and do that. I wanted to make sure that I took care of my own stuff, my own issues, to be a better helper to other people. And so we're sharing the method and sharing some of the things that we've learned from this process.
You
I think Michelle brings up a good point though, because people on the island, we're island people, and we're always out there, and we want to put people first, and we want to help everybody else, and we fail to recognize that we have to also help ourselves. And so we hope that there's going to be a lot of people that are out there, maybe they don't think that they need help for themselves, and they're going to come to help someone else, and we invite you as well. But we want everyone to know that it's so important that you have to put yourself first. You have to be able to heal and understand what's going on inside of you before you can truly be present to help other people. So that was a really good point that you brought up, Michelle.
You
Self-care, right? The buzzword.
You mentioned a widows support group, but is the grief talk? Or it's not just for women, right? It's also for men.
Not. Okay. Yeah. Yeah, absolutely. You can definitely come.
Yeah. And that's what sets grief, the grief recovery method. It sets it apart from a lot of the more, specific types of services. Like, I used to also facilitate a survivors suicide support group, survivors of suicide support group, widow women support group. We have all of these different things. And, one of the things too, Bree and Chris, that I believe prevents people from getting help, right, or help seeking, is the stigma that's placed on these different labels. Grief, there's over 40 different types of losses that will be pretty much considered grief. Many people think that it's just really reserved to death or divorce, like I did, but it's everything. Financial loss, it's even like losing a job, that's grief. Getting diagnosed with a terminal illness, your quality of life because your health is changing, intangible losses, like I mentioned, like loss of control, loss of sense of security. Different types of losses, again, contribute to that. So it's not gender specific. Loss is not gender specific, and neither are feelings, right? And I think that's something too, based on just growing up on the island of Guam. It's like boys are not supposed to be sad. Boys are not supposed to cry. And then we find out that, you know what? Again, feelings are not gender specific. Everybody basically will go through some type of loss, and some of those feelings are universal, like fear and confusion and, different types of things that we go through, right? Mm-hmm. So, yes, Chris and Jason, you can register for this evening.
Can you take us through the format for tonight and what people can expect? They register, they go into... Is it like a Zoom, a Google Meets?
It's a Zoom room.
In the Zoom room, and then take us through what's going to happen.
And the link is in comments too if people want to register.
So basically, like Michelle said earlier, it's really just about conversation. Mm-hmm. And so we're going to open it up. We're going to set a few ground rules to make sure that we provide a safe platform for everybody that comes in to the Zoom room. And, it's all about just coming in to either share your story and know that you're not going to be judged by us or by anyone else in the Zoom room. We're going to share our individual stories of what we're going through here through this pandemic, what brought us to grief recovery. And then we're going to share some of the different things that we teach in our grief recovery program. So we're not going to teach the program itself, but there's definitely some components of it that we're going to share with people so that they can at least walk away with something. They're not just going to come in here. It's not just your typical support group that you come in and you share your story and you walk away. We're definitely going to give them some tips that they can use as soon as they walk away from this grief talk that can help them feel so much better. They're going to learn so much more about grief than they've ever learned before. And then we're going to share with everyone our programs as well. So what they can do if they wanted to dive deeper, if they know that they have some deep grief that they need to work through, and how they can contact us to work with us through our programs. But again, it's all about conversation. This is the first of 4, you guys. And so, we want to be able to set the foundation for the next 3 talks. And it's going to be every Wednesday in the month of September. And the other 3 talks will actually be a little bit more specific to a topic around grief based on our participants that have come in tonight and talk to us about what they need or what they want to see from us. And then we'll dive a little bit deeper in the next 3 sessions.
Let me ask you guys this, and you kind of touched on the point a little bit earlier, Darlene, but we see it, and usually it's applied to when someone in the family is sick, dying, or has passed, where you get the head of the family and the whole family is telling that person, whether it's a man or a woman, that oh, you got to be strong for everybody. You got to be strong, right? And so, and I know you had touched on that kind of briefly, but what's wrong with that, and why is that problematic?
So it's a myth, because strength is not hiding your feelings. There's actually, being strong is being vulnerable. Being strong is telling your emotional truth. Being strong is not pretending that you're okay, because even yourself as a man, right? Not to target you or anything, but a lot of times men are, the gender that feel that they need to hold up their families and they need to be strong for their families. I know that when my husband died, that I was told that I needed to be strong for my kids, and I needed to be strong for my husband's family, and I needed to be strong for my grandkids. And for me, deep inside, strength meant holding in my emotions, not showing it to anybody, not crying in front of my kids and my grandkids because it would scare them. But that isn't strength. Strength, again, is about sharing your emotional truth. And, what we learned through our grief recovery programs is that human emotions are meant to be processed. Our bodies are emotional processing plants. But most of us are taught to suppress it, to not feel those bad feelings, to ignore them, to pretend they're not there, or to intellectualize them and tell yourself all the reasons why you shouldn't feel that way, right? Hence, don't be like that. Don't cry in front of your kids. You have to be strong for your kids. Go out there and greet your guests, because you got a ton of people here that are here to give you their condolences. Wipe your face, put on some makeup, and go out there. Hence, be strong.
Yeah. And I just wanted to add,
to be strong.
Yeah, very hard, because the same thing happened. But what happens, Chris, just to kind of put a little bit more onto that and underscore it, is when we are strong, we keep all those feelings bottled up inside. What happens is we need an outlet, like Darlene had mentioned, right, to process those feelings. It'll now probably move on to trying to escape the pain, to avoid the pain, right? Or to mask the pain. So hence the substance use, hence the suicidal thoughts, hence the retail therapy, shopping excessively, hence the comfort eating, and just emotional eating.
I feel
hence
attacked.
I
feel attacked on the emotional eating. Yes, I have a problem with empanada.
Comfort food to you? Yeah. And so, we call it, and we're going to talk about it tonight, but we call it STIRBs, and it stands for short-term energy relieving behaviors. It's temporary fixes, again, to something that really requires to kind of like go in there and dissect it and figure out what's going on and go through it and work through it. Mm-hmm. So a lot of times we're always just covering it up with a Band-Aid, our wounds.
It's interesting, and I want to tell just a personal story. So my mom, we've had two of my mom's sisters pass from cancer just within years of each other. And in the case of her youngest sister, Auntie Genny, it just happened so fast. I mean, it was like 1 month she was watching my kids, the next month it was like, oh, I feel dizzy. I think it's my vertigo. Find another sitter. The next month it was stage 4. Off to Minnesota, where it just, in a matter of months, she was just gone, right? And so I tried to be strong for my kids, and what ended up happening is one day, a few weeks after, we'd buried her, we were driving, and a song came on that it just really reminded me of her, and I broke down crying, and my kids were like, whoa, Dad, what's wrong? And I was like, man, Auntie Genny used to love this song, and it just reminds me of her, and it was a song about not being able to say goodbye to someone. So you're right. I think a lot of times we do kind of hold these things in, and they come back to bite us in the noggin, for lack of a better term, at a time that, that you don't control. So.
Right. Yes. Uncontrollable emotions tend to come out when we least expect it. So thank you for sharing that, Chris. I know that may not have been easy for you, but that was a perfect way of being vulnerable and showing strength to show your kids that it's okay to cry. That was beautiful.
Oh, thank you. Let me know if you need a presenter.
Register.
Okay, ladies. So
you should be on the Zoom first.
I just wanted to ask before we go. There's been 19 COVID-related deaths to date, 7 or 8 just in the past several days. And so I'm not sure. I don't think that a lot of these families are going to be able to participate in this grief talk because of what they're going through right now. Is there anything maybe you can say to them, to these families? just to help get them through this time?
Yeah, so I to the families of all the COVID patients that have died, my deepest condolences on behalf of myself, Michelle, and our grief recovery team. And just know that everything that you're feeling is all very normal and natural. And it's okay to feel the way you do. And, I just want to encourage you to reach out to family and friends. Don't ever feel like you need to be alone in all of this, even though this period of isolation that we are experiencing does really kind of, it really does make it feel like we're always alone. And, it magnifies that piece of grieving alone. But, we also are going to do a replay on this in our Facebook page. So it's called Giving Grief a Voice. And everyone is welcome to either watch it live, because we're going to stream it live, or watch the replay. So people are not necessarily going to be able to join us for whatever reason, some of those that you had mentioned, Bree. And so, yeah, we'd love for people to come on and listen to the replay. And it's also a way that you can also get a hold of us. So when you're ready and you'd like to learn more, or you need what we call a heart with ears, you can definitely contact us through our Facebook page, and one of us will definitely contact you.
Michelle, any final words?
Just thank you again. This is just an opportunity. Since my child was a little girl, I always gave her permission to talk about the hard things. I always tell people, if we could celebrate those accomplishments and successes, then why can't we talk about the challenges and things that we feel like are failures in our lives? Because that's the only way we're going to be able to come to the dinner table together and just kind of troubleshoot some of those things. So tonight, it's just really, really honoring space, honoring people, honoring their grief journey again. Not everybody is in the same boat, but we are facing the same storm. And I just like to thank everyone for being on the show tonight, and we look forward to seeing you. And thank you, Chris and Bree and Jason, for having us on.
Thank you for having us.
Thank you.
Okay, thank you guys for coming on.
And we have put the link that you ladies have provided where people can register. We've put that in our comments. So if anybody wants to register, just please hit that link, right, ladies, and just register and you're in, right?
Yes. Yes.
Is there a fee for the to register to come on?
It is absolutely free.
All right. There you go.
Okay, thank you,
Thanks,
ladies.
Star. Thanks,
All right,
Michelle.
thank you guys so much.
Good talk. Good talk.
Yep.
All right.
Stay
Bye.
safe.
Wash your hands. Stay home. 704, we're KUAM FM in Agotni, Guam. Yeah. There was a physicians advisory group meeting last night, so we're going to catch up with our man, Dr. Wen, with that. And then we got public health, Dr. Jan Maglotnia and Annette Uggan, to kind of go into these numbers and the contact tracing. Hopefully we'll be able to shed more light on and get more details. Yeah. Coming up at 7:05, again, we're KUAM FM in Agotni, Guam. This is The Link on The Breeze, 93.9.
GU Self.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Hafiday, my name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers for Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
Half a day. My name is Kathleen Fernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
Naturally, something I just can't ignore. When I step up on the shores, the feeling that she gives me leaves me wanting more and more. No matter where I go, she leaves an imprint on my heart and soul, my heart and soul. Heart is loose and heart grew. I'm nothing without you. This feeling is so true, and this I know. Even when I'm far away, I know you're never gonna leave my side. Forever feel your warm embrace.
Hey, good morning, 7-Eleven. We need another show for all the stuff we talk about in between. I'm glad we wear these masks because ain't no lip reading.
That's when ghetto brie comes out.
Yeah. And we got to get our Zoom guests to sign a waiver because they're just in here like, oh my God, what?
I didn't say anything that I really don't care for people.
I know.
You know.
7-Eleven, let's go to the KWM new Zoom room where Dr. Hoa Wen is standing by. Doc, are you posing or are you frozen? Okay,
oh, no.
do it. Yeah.
I'm still flexing.
He's just pretending not to hear all that. So. Good morning, Doc.
How was your meeting?
Good morning, guys.
Good morning. How was your meeting? Short, long meeting?
Our meetings? Meeting very good. I mean, we talk quite a few things, but just to update you guys for a few things we talked about last night. You know,
You're freezing.
the new travel quarantine. We pretty much set except that we. You got hear me?
Yes, we can hear you now. You said you guys talked about quarantine?
Sabrina?
We can hear you. Yeah, keep on, Doc. Go ahead.
Hello?
Hello.
Okay. Yeah.
Can you hear
we
us now, Doc?
talked about the new Q factor. Yes, So we're going to try to roll out the 7 days, testing out the Q factor. And basically, they're going to have the one of the program called Sarah Alert to be ready. Once that's ready, we're going to roll it out. Right now, to make sure that the Sarah Alert have all the insurance and the legality of it to be in place, and then we're going to roll it out. But everyone kind of agree that's the best program we can roll out. Finish what it's doing. We can roll out the Q factor testing out 7 days along the Sarah Alert. Okay, so we asked them to kind of fast pace that, so hopefully in the next can go home earlier. Okay, so right now it's still the 14 days until that new program coming out.
Doc, let me ask you because I got a friend.
Everyone on board
right.
at this time.
Doc, what if someone is?
Oh,
wow, this is a really bad connection. Yeah. Doc, what if someone's traveling into Guam with a 2-year-old child? What are the quarantine protocols in that type of situation? You want to try and boot him and then get him back on?
No. Someone come in the whole family, we quarantine the Q factor. Okay. Because there's no
exceptions. So I guess the way we understand it, and just reading through the guidelines, is that there are no exceptions to the 14-day government quarantine when it comes to travelers, except I guess if you're a medical professional, right?
Right. I mean, if you're a medical professional, then you can quarantine at home because you consider essential to the community, but everyone else is going to be in the Q factor if for full 14 days. That doesn't matter what your age is.
Was there something, Chris, that you heard?
Or? No, I didn't hear anything. I just wanted to clarify because I just know somebody who's traveling with a young child, so I wanted to just check if there's any difference in the protocols.
No, Chris, it's the same. Even for minor now, if you minor can travel themselves, but now because some minor turned positive for the COVID, they actually have one of the parents take minor Q factor. So they cannot take the minor home.
I see.
And so
yeah,
so when we talked last week, you said the Sarah Alert, it's going to be mandatory for people to download the Sarah Alert in order to be excuse me, for the 7-day test out, right? And that's still in place whenever you roll this out.
Yeah, that's still okay. I mean, right now, I think the Sarah Alert on the legal side of the house will be clear, and then once it's clear, we will roll out the program. But we don't want to send people home after 7 days testing out without any type of monitoring of their symptom at home for the next 7 days. So that thing you have to sign in like 2 or 3 times a day and report your symptom. So it's very good. We all pretty much agree that has to be a must to have. You can refuse. You refuse, you stay in the Q factor for 14 days. That's program they do. Saipan do the same, and look like the program working out very well. So we just need to get on board and get that program together.
Saipan has the Sarah Alert?
Saipan use Sarah Alert, and there's people when you go there, you have to use that for the next 14 days when you arrive. So
Wow, Doc, I gotta ask. So, I mean, I'm sure you guys discussed like the CNMI and how they are faring with COVID-19. Does that topic ever come up in these PAG meetings where people are like, God, can we just get the CNMI's playbook, or is it just entirely? Do you believe it's just entirely different circumstances with their political status and what they're able to do that we aren't?
no, we talk about them all the time. I mean, they somewhat much more. I think conservative they actually test you when you get there, and then they test you day 5 on the testing out, and then they put the Sarah alert, so you have to use it while you're there. So I mean, it's the same concept that we tried before, that we kind to have people home quarantine, but that don't work very well. So now that we go in reverse direction, we're going to quarantine them for the first 7 days, test them out, and then do the Sarah alert. And again, if it worked well, we see the compliance rate is good, we can roll down to 5 days. But that's a thought, in the future, the 7 days working out well.
Mm-hmm. So you get the Sarah alert, and you test negative, you get the Sarah alert, you're out on home quarantine for what, a remainder of 7 days, for a total of 14.
7 days.
Right. So what do you do when you're done with the 14 days? You just get rid of the Sarah alert on the phone, or what?
Yeah, you can get the Sarah alert off
Okay.
them, and you're done. It's a web-based, so
Right.
you release from your home quarantine.
How
so you'll be fine.
soon? How soon did you say we're trying to get this done?
We asked them 1 to 2 weeks because they really have the fast pace. I mean, the quarantine team are working on it. Like I say, it's on the legal side. We say, well, can you not drag your feet and really roll this out really quick? Because, the Q factor for 14 days kind of long, and we need to kind of let people go home early. So we ask them fast pace, so we're going to ask them again every meeting. So we do Tuesday and Thursday. So every meeting, we're going to keep harping on that one.
AG legal side you talking about, or governor's office legal side?
I think they have to do some type of insurance. I don't know. That's too much on information that I want to find out. But I know they have to get some insurance for that, all that kind of stuff. So, like I said, we ask them really fast pace because we really need to move.
Who else? I mean, not who else. What else did you guys talk about last night?
Okay, so the other one is that the new apps for Guam, right? It's going to roll out sometime on this week, Thursday or something. Guam COVID-19.
Yeah.
That one is pretty interesting. So if you guys don't hear about it, then it's on GVB and on the media and everything. But that's something that people voluntarily download to their phone, so they kind of monitor you. If I'm a company employer, I would download all my employee on it. Just because that help with the contact tracing, right?
Mm-hmm.
I mean, if your phone talk to each other, even you don't like it or not, when you recognize you sit next to someone, and if you sit next to someone that's positive for 15 minutes and 6 feet, within 6 feet, if that person turned positive and public health download the program, it will notify you if you did come in contact with someone that COVID positive, and tell you what to do and when to test, all that kind of stuff. So it cut down the contact tracing a whole bunch, and it helped a whole lot. So if I'm a company, I would probably pretty much interested in that, just because it tell you, hey, this person is positive working in your office, and you that close to that person for 15 minutes, maybe you want to get tested. So rather than test the whole company, so that's something that is very helpful. I would encourage people, especially the company, to download on the employee phone, just to make sure that you protect your company. But I think it's rolling out on Thursday or Friday.
Yeah, there's supposed to be a press conference tomorrow. Janella Carrera was on our show yesterday. She couldn't really speak a whole lot about it because the credit has to go to Adelaide.
Oh, that was crazy.
So just
that was crazy.
Yeah.
I'm sorry. I just got to say that was like, Doc, we all know about this app, and Janella was like, "Oh, I can't talk about it because the governor is going to announce it." Like, dude, we all know about it. We're talking about it.
We all know about it.
Oh, you're not at Adeloop anymore, girl. Come on.
Yeah. Where did this app come from, though? I mean, who developed it? Did we hire somebody to do this?
It's Google and and Apple have this one. It's just free. You know, it didn't
Okay.
cost us anything.
Okay, that's good.
And I think we are the first place on earth to use this thing. So, you know, they want to give us for free, and it's very good to help the tracing of the positive contact. So I would say that there's nothing secret about it, and so it's very good. It didn't cost you anything.
Good.
So I would say that if I tell you, all my clinic staff probably will be on it. You know, just because that way we can find out if anyone really have a close contact with a positive COVID patient. So it's interesting. So I guess, like you say, they're going to roll out a brief conference on Thursday, and
Right.
hopefully they'll be out by this week or next week.
Doc,
And it's voluntary. You don't have to do it.
Was there any discussion at all about the end of the PCOR 1 lockdown and an extension or anything?
Sabrina, that's really up to the hospital. They have 53 patients in there, and 11 on the vent, and a 14 ICU level. So it's very tight in the hospital. So PCOR 1 is really depend on that one. I think that anything else, be PCOR 1 plus some relax or some restriction, but I don't think we're going to get out PCOR 1 until the hospital kind of slow down a little bit. The one that we really like people to help is that the high-risk patient, especially the dialysis patient, guys. I mean, we had to pass the word out there, and you have a family member that on dialysis, you have to do everything you can to protect that family member. Dialysis patient does not do well in the hospital. They got COVID-19, and like it or not, if they have COVID-19, they will be at GMH for the full 14 days on dialysis. That's a long way to sit in the hospital. You cannot go home. So you really need to protect very high-risk patients. Like I say, those patients does not do well with the COVID-19, and most likely you might lose the family member. So it's very important, especially with the young population from 20 to 40. If you have a family member that have dialysis in the family member, then just don't even come close to them. Protect them at own cost. And that's what we ask them. Because 14 days in the hospital yourself is a long time.
Doc, can I ask then, you said 50 hospitalizations over at GMH alone, right? Are a majority of those that are at GMH, do they have comorbidities? Or are they just there, or a majority of them just COVID, period?
They're all, most of them have comorbidity. Sabrina, one of the comorbidity that is very clearly a high risk for complication of COVID-19 is obesity, right? I mean, if you're overweight, you already have a plus on your chart already for comorbidity. Even you don't have high blood pressure or diabetes, anything, overweight is one of the risk factor on that put patient with COVID-19 at risk. So yes, most of the people, at GMH, they have some type of comorbidity. But again, if they have it and they're well controlled, this thing can turn on you really quick. I talked to Dr. Agon last time, and people can give you a thumbs up and say they do well, and about 2 or 3 hours later, they down. So it's really can attack your lung very quick, and we really have to take this thing very serious. You can smile, put your thumbs up, and a few hours later, you're done. So it's really, it can turn around the corner here really, really quick. So we really have to be serious on this virus. We always think it doesn't happen to us, but yes, it can. It happens to anybody. So we got to be careful.
Has there been some sort of a change? Because I know that it was GMH is supposed to be the COVID hospital, and GRMC is supposed to be the non-COVID hospital. But when you look at the breakdown for the hospitalizations, it says that there are COVID patients hospitalized at GRMC. Oh.
At GMC.
Yeah.
Why is that? is it based on you have the capacity to handle them or not? If the GMAs are on full,
Okay.
then you can't transfer the patient. Because the patient show up in the emergency room on either hospital, including the Navy hospital. But if you don't have the bed to transfer over, you're stuck with the patient.
So that's
So that's
why,
what's
that's
going
why
on,
we're
right?
saying, okay.
Okay.
Yeah, and it's a bed capacity, it's a nursing staff capacity, right? I mean, GMH did lose some nursing staff with an infection. I understand that some of them come back already. Okay, and there's some FEMA, some federal nursing staff and physician there to help them. Again, you kind of nursing staff. Kind of capacity wise. So once you max out at 53, you really be very careful in accepting any more, COVID patient. If they show up in the emergency room, you're stuck. You can't move them. But if they show up at GMC, then GMC will stay with them until GMH have some room there.
Yeah, and I know one thing that Lillian told us yesterday. She said that we're no longer accepting ICU, right?
non-COVID ICU cases.
Yeah.
Exactly. They are 100% ICU COVID. They're max out.
Wow.
You can't put any more people in there.
I wonder how much of
right
it
now,
those.
they have 14 ICU patients right now, and they max out. There's no more room left in the ICU.
Was there anything new about opening up the SNU? We just don't have enough staff.
Yeah, I saw the stat there. There's like 8 people at SNU. I'm not sure that COVID or non-COVID, but there's 8 people there somehow.
Wait,
so
what
they
you,
are,
huh?
8
I
people. Think I saw. They say SNU. So I think if Lillian coming after this, she can answer you. But I saw the stat that SNU say 8. So I think there are patient there. I think.
Oh, was that on the sit rep? We'll check. Well, we got public health coming up next week.
Yeah, the sit rep on that one.
Oh.
But I think they open already. But right now, beside the COVID patient, primary care physician outside really step up and do their job too, because there's a whole bunch of non-COVID related patients in the hospital too. So people are staying home. They eat and they don't exercise, and they get in trouble. So as an outpatient, the primary care physician have a very important job to keep their patient out of the hospital. So it's hard. So we got the attack on both sides here. So people just have to be careful. That's why I say exercise is the key. You got to exercise somehow.
Yeah.
Okay.
All right.
Yeah. The other one, guys, is the company now. You can see the port, right? They stand up their own tracing, contact tracing team, and it helped a whole lot. I talked to the director yesterday, and big company, if they want to step up and do their own contact and tracing, public health can train their employee to do that. It really helps. It's something that private-public partnership, and that really help public health and do the contact tracing. Right now, as you hear, they're like 4 days behind, which is really too late. They're supposed to be 1 or 2 days. So if the private company want to minimize the work loss of their employee, then they can step up and form their own tracing team. Like I said, public health are willing to train them. So that's one thing that there's a program, the UCSF program that came in last week. It's very nice. One of my chief nurse went to there, and very soon to learn, and you can form your own team.
Oh, that sounds cool. We can get T-shirts. KUAM contact tracers.
It's
hey, who were you with last night?
Nice. Huh?
No, we're just Doc. Is there anything in closing? Because we do have public health, and we want to get over to them and look at the public health side of this.
Yeah, they do a very good job. And you see yesterday, there's 43, right? But 37 of them are contact tracing. So kudos on them and track those patients. That's a big help. 37 out of 43. So they are doing some work.
Wow.
A lot of work there. So thank you for them for doing that. Again, the real message for the people in Guam is that, wear your mask, wash your hands, social distance. And if you have high comorbidity, like patient with dialysis in your family, please we'll take good care of them because we don't want to lose them. So we ask for your help. Okay.
All right.
Thank you, Doc.
Thanks a lot, Doc.
Okay, guys, don't work too hard. Okay. Have a good day.
Too late. There goes the sweat right there. Oh man.
Okay.
Thanks, Doc. Appreciate it.
Okay. Be safe.
You too.
Chris.
Yes.
Next show, I will be with Dr. Agan.
Nice.
Awesome.
Okay, so we'll do it tomorrow.
Okay.
Okay.
She agreed already. Okay.
Okay,
On
so-
Thursday. Okay. Okay. Bye.
Okay, yeah. Thank you, Doc. Right on.
I didn't see anything on SNU.
I don't know. Well, let's just keep it going here. 7:31. We'll go back to the KUAM News Zoom room where we have from the Department of Public Health and Social Services the medical director, Dr. Jana Maglotnia, and the contact trace lead, Annette Uggan. Good morning, ladies.
Good morning.
And
Good morning.
Okay, good. Yes. Doc.
Can we hear Dr. Jana?
Oh, Lordy. Here we go, Doc. Totally didn't see that coming.
She's been in the Zoom room for a half hour waiting to break that one.
All right, man.
Well played.
Ooh. Good times. Welcome back, Doc.
And there isn't a tape strong enough to keep my pie hole
Yeah.
shut.
Pie hole. I don't think you can say that.
Oh my God.
We're
I can say that.
Yeah, you can say pie hole. Say it more.
No, well, you know what? We have a segment on the show that we put out on Facebook called "In Case You Missed It."
Yeah.
I think we just found our segment for today.
Oh, I don't know how to follow that. Go ahead, Bree.
No, I'm just like, wow, I don't think I've ever seen you with your hair down. It's nice.
Oh, yeah, yeah.
I used to before COVID.
Yeah.
But I just throw it up. It's fast. And
Right.
I was up till midnight just with conference, and then through the night, GMH calling. You know, it's pretty steady through the night. So
Right.
I haven't had time to put it up yet.
Well, I was a little distracted by the tape over your mouth. Notice your hair. Okay.
You look good. You look good.
Yeah, good. Hi, Annette. Hey, Annette.
Hi, good morning.
Good
morning, Nettie.
Let's just get right into
Morning,
it.
Dr. Jana.
With what Dr. Ho had said, and we'll just start with Annette. And is that accurate? So the 43 positives we reported last night, 37 were found out through contact tracing done by public health?
35 are contacts and 2 were through travel related. So the other cases, is preliminary. We have to verify if there's any links to known cases or if there be it household or community contact. So those investigations, there are times where we find out the link, after the cases are reported to us, and we look backward to where they've been, and places they've been to and where they work. And so that's where sometimes we connect the dots after the fact.
Could you give us any more of a breakdown on so we had 35 contacts, the known positives. Were these from what types of gatherings or, from where?
We've seen a lot, unfortunately, household members, where one individual became sick and then unfortunately went on to other family members, be it the spouse or the children. We do have a few who are community contacts, mainly like they were coworkers. They brought it home to their family and then unfortunately spread it to their family as well.
And we have had some that I don't have numbers, but of the ones in quarantine, we've had some of those turn positive too. The ones that were taken from the flights, we've had positive cases from there as well. Which is good because they didn't, no big deal because we didn't let them out in the community. So those were contained.
So were these positives that they turned, well, because I think you said turned positive. Was it on their first test in quarantine? At which day mark?
Some came in negative and turned positive on the retest in quarantine.
So on that note, let me ask you, because I know that we had just we were doing a test program for allowing people in quarantine who test negative to go attend funerals, and And I stumbled onto the scene. We did a whole story on it. And at the time, the issue that I had that, we weren't able to really communicate was that you're right. People test negative, and then a couple days later they test positive. So there's that window where you might be negative and you're going off to your relative's funeral, but you're really positive. Have we scrapped that whole pilot program?
We've closed that gap. If you leave quarantine, it's with a negative test.
Okay.
Meaning, if you want to go somewhere, you're going to be tested.
Right there.
And if it's negative, then you can move on, by and large. And those are special situations. And I wanted to emphasize that, too. Although it looks fairly rigid, we follow a protocol, but there's always room for extenuating circumstances. So, we come into we run into those, and we do workarounds for those. So don't hesitate to ask if there's something compelling and you're in quarantine. We follow protocol, but there's always room to ask if you have some need. So I wanted to get that out there too. And we run into that frequently.
Doc, I wanted to ask about this argument that I see on social media. And, I've got my own opinion on it, but it's with the classification of these deaths as COVID-19 or COVID-19 related. Just from the medical standpoint, can you kind of go into the whole process? Because, and I've talked to a bunch of doctors, and I know we're following the same process that everywhere else is following. But if you could explain why it is, for those people out there who don't understand or want a better idea, why is it that when we have these patients with the pre-existing comorbidities and they get, they test positive for COVID and they die, we classify it as a COVID-19 related fatality? So I guess just go through what the virus does, how it accelerates death, from a medical standpoint.
Comorbidities in general impact your immune system, and that's the only thing you've got to fight the virus. So if the only tool you have is impaired, then you're not going into battle with a full armamentarium. You want to go in with everything intact to fight this thing. And some have no symptoms, but some really take a hit. And I heard Dr. Nguyen talking about how fast people turn. I can tell you this last night, or maybe it was 2 nights ago, I had a patient that was evaluated, young person, evaluated at GMH. He was in isolation, wasn't doing well. We transferred him out. He was evaluated. And at the time the report was given to me by the physician, everything was stable as it could be. And he was eating, doing fine. In the drive to the isolation facility, by the time he arrived, he was unstable. His oxygen had dropped. He was short of breath and had to completely turn around and go right back to the hospital. So that's how fast. And I've seen online where with most illnesses in the hospital, if people are improving, it's usually a steady trajectory to discharge. They get better, better, better. With this one, people can be better, 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 and then crash. And that is not something we usually see. And Dr. Uggan will tell you that too. She says usually by day 5 or 6, but I read a blog online where a gentleman said, I was doing fine for 4 days. All I know is I awakened on day 7 and I was being extubated. They were pulling the tube out. He had been on the life support for a couple of days and didn't even know it.
Do you have any?
So it's go ahead.
No, I was going to say, do you have any information on like the length of stay for a COVID patient at the Guam Memorial Hospital?
Oh, that varies.
Estimated.
It's not there. An average wouldn't even mean anything because some people have been in there for 40 days, 30 days. Some are in 1 day, and it's all over the place. It just depends. The critical care. I think Dr. Nguyen mentioned that they're 100% COVID right now, and they have 53 in the hospital. 11 of them are on the ventilator, 14 are critical. And early on, the death rate for ventilator patients was around 80%. And some of the newer data, I'm not going to say studies, but the newer data is showing that it's hitting around 36%, which is still not good, but better than 80%. So 4 to 5 out of 10 may not make it off the vent. So it's very serious. And I wanted to emphasize that even if you're in a low risk group, you may pass it to someone who is in a high risk group, and they may not survive it when you have little or no symptoms. So, we've got to really emphasize what he said too. Please take care of the elderly and the sick and the obese. There was an article in Washington Post today that people under age 60 who are obese are more likely to be hospitalized, end up in the ICU, and die. And we can't say that for many other illnesses, but this one, yes. So that was just out of the Post today.
Wow.
So also, I want to emphasize this. Sorry, Nettie, but I'm on my soapbox again. We've had several. That arrived in either dead on arrival or nearly dead on arrival, which tells us that those people have been sick for at least a day or 2 days, maybe more. If it's that fast, maybe they didn't have any notice. But we just want to emphasize that you get help early. Seek help earlier. It's much easier to treat the earlier you get to the hospital or the earlier you get to your clinic, and we can identify the problem. So don't wait. Don't wait till it's too late. So please go early and report early for evaluation.
That's very key, Doc. Annette, let me ask you to kind of bounce off what Doc Maglonia just said. So when someone does show up at GMH, dead on arrival, near dead, test positive for COVID, can you explain the process of the public health contact tracing from that point? Because then you guys would have to work backwards, because like Doc Maglonia said, if these people were already sick, I'm only assuming they were coming into contact with, all sorts of people.
Annette can answer that one.
Right.
Yes, we would still initiate the case investigation and contact tracing. There have been some instances where the individual had already tested positive and was brought into GMH as a known positive, and so those case investigations had already been initiated. Contact tracing was already completed. There are some where they haven't been tested yet, and again, it goes back to that we cannot force people to be tested. We just highly recommend that they be tested. We've had instances too where other individuals in the house were also symptomatic, and so it's something as Dr. Jana mentioned and Dr. Nguyen, it's the elderly, those with medical conditions that they're the ones being hit hard, and to find out that other family members were mild, moderate illness prior to their high-risk family member coming down with any type of symptoms, and they're the ones who are dealing with the complications, hospitalizations, or unfortunately death. But yes, we still have to continue with contact tracing, case investigation for those who have passed away.
And then, just to expand on that, so we had 35 of the 43 positive last night from contact tracing. What's the status of the 20 million contact tracing investigations you guys are doing? Because I'm waiting for these numbers to kind of wash out, but they're not.
No. Well, we still have to interview each of the household or close contacts. We do schedule them for testing, and so we do have a lot of contacts who are still negative, asymptomatic, and they're cleared to go, after they finish their quarantine. We unfortunately have some situations where one family member tested positive, is going through their isolation, their family members are being quarantined, then they get tested, they're positive, and so unfortunately the cycle continues for that household if they're unable to separate themselves. So someone may be finishing their isolation, but if a family member in the same house now tests positive, your roles are reversed. Your family member is now under isolation, you now become under quarantine. And so we've seen that in a few instances. Wow. So again, it goes back to practicing, social distancing as much as possible, separating yourself. I know it's hard with our culture, a big household, in the same house, multi-generational, but we have our residents are are very helpful. They're compliant. We have, again, success stories that may not be out there in the media that they had a positive in their house. Everybody else stayed negative because they complied with the social distancing as much as possible. They ate separate from the person. That other person stayed in their own room. They timed it where if they only had one restroom, but they disinfected after they used it, so the quarantine family members can use it and reduce the risk of exposure. So we do have those where being compliant, cooperative, they've helped us to stop the spread within their own household by following what's recommended by CDC and public health.
We've seen some of the numbers.
Others, it may have just, I'm sorry?
I was going to say we've seen some of the numbers increase with the military, and we get the press releases about like NEX cases, positive cases with NEX, and I think it was a daycare center. Do you guys assist with their contact tracing at all? I know we heard about USS Frank Cable. Do you guys help?
We have a collaboration, and so like with the military members, depending on which unit or branch that they're assigned to, like if they're Anderson Air Force Base will take care of them. U.S. Naval Hospital will take care of the Navy, and if there's National Guard, we also have National Guard assisting in regards to the investigation, contact tracing. There are instances where they do ask us to take care of civilian contacts outside, and we coordinate with them, and we get the information, and we will do the interview, and we will do the scheduling for testing. So there is that collaborative effort, and Naval Hospital too is the pretty much catch-all too, that they'll take care of. You have the veterans, the retirees, and their dependents as well. But we do have that collaboration that we work with them, and they inform us if they want us to take care of certain civilian contacts and to handle the investigation as well as the testing for these individuals.
Do they take part in the contact tracing training? I know the port. I think it was Dr. Nguyen who was mentioning how Port Authority and even his staff had taken part in the training that was offered, I think, at UOG. Do you guys see the more military taking part in that, or are they just pretty much on their own?
Well, they have their own training, but I was informed that the National Guard had sent some representatives in regards to, yes, the Port Authority of Guam. Yes, they stepped up and they had people trained. Same thing with GPA. And yes, that's definitely an avenue that has helped our department. They were the ones getting the names and the contact information, looking at the work schedule. And so they provided that update to our team, which made it easier for our team. So we just had communication back and forth, the coordination to schedule these individuals for testing. And so moving forward, that's the plan with this UOG UCF training. We want to take advantage of these individuals who were trained, who go back either to private sector or GovGuam agency, and tap on them being trained and to utilize them as our point of contact or liaison, that God forbid they have a case in their agency or their company that we can, you're our main point of contact, you're already getting the information for us, so it makes the contact tracing smoother and faster.
Mm-hmm. So right now, in terms of like agencies that have their own contact tracing teams, you can say the Port Authority and GPA?
Yeah, they've had individuals take the online course, and then they've been in communication with my team in regards to next steps, and how to move forward with testing identified employees for, that close contact. And then there are some future steps we definitely want to tighten up. GPA has reached out, and so, we want to continue to strengthen that partnership because, again, as a critical infrastructure, those guys have really taken the initiative to make sure that all their personnel are safe and to know how to monitor them and who to identify as a close contact so that they can work with us to get them identified, quickly quarantined, and to be tested as needed.
And some of the construction companies, sorry to interrupt, but some of the larger companies have even learned how to do contact tracing and investigation, and they have their own isolation and quarantine units on their sites. That's what I've been told. I haven't seen them, but I've heard that from several people.
Mm-hmm. Dr. Jenna?
Yes, they were actually...
Go ahead, Annette.
I'm so sorry. With like construction companies and other, especially because we're talking about congregate housing areas. Prior to COVID hitting Guam, there were some planning and discussions with these construction companies just because we knew they were high risk. And so those were things that some of these companies were preparing even prior to COVID arriving on Guam. And so they've been a big help for us as well, just because they're critical to the military buildup or construction out here for Go Guam or the private sector for residents. And so that was something that a lot of these construction companies did take the initiative and set up, okay, if we have any case in our company, this barracks will be considered isolation and other barracks is quarantine. And so they've been helpful, as Dr. Jana has mentioned.
Mm-hmm. Dr. Jana, I wanted to follow up on something you mentioned, 100%, I think you said 100% COVID GMH. Were you just talking about like the ICU? Just the ICU. Is there any movement towards making GMH just 100% COVID?
That was the initial plan, and we've tried to stick to that. And it was fairly, it was working well until the census went up. And then there are some at GRMC that have to remain if they test positive until we can make room at GMH. We've run into that. Mm-hmm. I think there are maybe two, at GRMC, but we try to get everyone moved over to GMH as long as there's room. And that's something I want to point out too. I've said early on, and now it makes more sense. It doesn't matter to me if there are 200,000 or 500,000 cases of COVID on Guam. Having said that, if the hospital's empty, because that means that everyone is having mild disease. The number goes away when you have the hospital saturated. And early on, I was reading in Italy where a physician was really struggling with post-traumatic stress because she said, I'm down to one ventilator. I have a 42-year-old mother in front of me with 2 children, and I've got a 62-year-old runner. I have one vent, one lives, one dies. Nobody wants to be faced with that decision, especially with the oath that we take to do no harm, then to decide life and death like that. It was just overwhelming in Italy, and I'm sure it was as challenging in New York. We don't want to get to that point. And so I don't mind how many we have out in the community as long as the hospital's okay. Mm-hmm. But that number has no relevance at all when the hospital is saturated. That is our major fire alarm. Mm-hmm. And so whatever numbers you see, the hospital is the one you really want to be looking at. Mm-hmm. So just to be clear about that, if they're mild cases, it's okay. We can handle that. But when we overwhelm our hospital facilities, we have to rethink our whole plan. And that's why the governor is trying to do what she can to put this fire out. Right. Because we are getting dangerously close to maxing.
So GMH, ICU full, and 2 are over at GRMC. Do we know how many, ICU beds GRMC has until, they're full? And then what are we going to do?
Oh, in the past, you could get a straight answer. But now, because we have prepared for overflow, that's a moving number. It's there's a way we can increase the capacity with personnel, with the equipment, but we don't want to have to do that. We'd like to just back off because it's just untenable what's going on, and the front line's taking a hit too. Nurses and doctors are also coming down with COVID. So better to mitigate than to prepare for the overage. But we've got capacity, but it entails mobilizing other resources, and we would like to stay within our own realms.
That sounded pretty serious.
Yeah.
Yes, they're exhausted at the hospital. They really are. It's taken a toll, and anyone who wants to open, I wish they could take a walk through the ICU and see the people on the ventilators and still say if they think it's a good plan right now. Right. It's a real rude awakening when. And I haven't seen it, but I work with Dr. Uggan through the PAG group. And when she joins us, it's just really exhausting with the things she says and the difficulty of taking care of these patients, because if a complication can develop, it seems to have developed on these. You can have an easy go in the unit and you can have a tough go. And she has had tough goes with these patients, challenging.
Right. Doc, we had we sent our condolences to the mayor of Assen this morning, and right, his daughter, the youngest, COVID fatality, just so tragic. Is there any more light that you can shed on this particular case? That, I mean, as the island is just, I think with the Monomco, right, we're protecting the Monomco, but a 31-year-old, I mean. I'm still trying to just wrap my mind around that, and it's just so tragic that,
We had a 34-year-old, 2 weeks before that, Chris?
Right. So what can you tell us about that?
Nobody's immune. Nobody is immune, and this thing is to be feared. Don't let your guard down. Just socially distance, wear a mask. I mean, those things have proven effective. The long-term plan will be to have a vaccine. We're not there yet. So right now, the community we implore you to do what you need to do with the old things: hand wash, social distance, and mask. Those have proven to stop the transmission of the disease. We have to use that because our health is in our own hands, and we have to do what we can until there is a vaccine available. This is all we have. We have quarantine and those, and very effective. They're effective if you use them. And so, and we all have let our guards down. I've had some near misses, and I'm really thankful that that I didn't contract it, and I well could have. But that's all we've got for now. So the community has to do that. Protect everyone. Protect not just the elderly and the sick, the kids, everyone. Just look out for your brother. And that's what we're known to do in the islands is, we all look out for each other. Right. And we have to hold hands and do that right now until there's a vaccine available. And hopefully before the end of the year, there may be one. And they're going to make sure it's safe before they launch it. So let's do what we can in the meantime.
Right. Let me bust in here, guys, and then we'll come back. I know Sabrina's a question. It's 7:59. We're KUAM FM and Agatna, Guam. This is the link on the Breeze 93.9. Thank you so much to our viewers on KUAM TV for watching. We'll jump over to our Facebook Live feed. You can do that now or catch it on the radio. There's also an audio stream on Docomo Channel 10, and we're streaming at KUAM.com and the KUAM News app. So to our viewers on KUAM TV, thank you for watching. Adios. And we're right back into it here. Again, 7:59 in progress with Dr. Genny Pennington and Annette Ugan of Public Health. Bree, question?
Yeah, I wanted to follow up on something that we had a conversation yesterday with members of the business community, and they talked about this possible new classification from essential to non-essential businesses to, is it high risk and low risk? I'm not sure if you guys have, or Dr. Jana, if you're aware of this conversation that's getting underway, and are you aware of that?
I'm not.
Not okay.
I'm not. Well, what's the gist of it?
Just so that more businesses, can open by changing it from essential to non-essential versus low risk to high risk, I guess, for exposure. And by changing it, you would be able to see more businesses open. So that whenever we go into, P Corps, changes in the P Corps, we wouldn't be where we are, complete shutdown, where we are today.
I haven't seen the conversation. I hear a lot, but looking down the path of recovery from COVID is a little challenging when we're in the middle of a response mode. All of our efforts and energies are focused right now, and recovery time and what we do when is that remains to be seen. We have a bigger problem right now. So I don't have any comment on
Okay.
that. I haven't seen the trend.
What about you said you described the situation at the Guam Memorial Hospital. It's a fire, more like an inferno, it seems.
Right.
And the positivity rate, I think it's at 9% now. Hospitalizations high. Do you foresee us extending the governor extending the PCOR 1 and this lockdown past Friday?
I can't predict what she'll do, and she'll follow the lead of the. She won't follow the lead. She listens to the PAG group, and so we present recommendations. But it would probably be challenging to open with the numbers the way they are, because we're sort of maxed out at the hospital at this point. So I can see holding steady for a period of time, whether that's days or a week. I don't know. That's just my opinion.
Right.
I certainly haven't gotten that from her, but you'd be hard pressed to open when you're in the middle of a surge like this and overwhelming our hospital.
So let me ask you, Doc, in your medical opinion, which we value highly on this show, how much longer do you think we need to be locked down in this current PCOR 1 status, in your opinion, to really put out this fire that is reaching every corner of the
watching
island?
the numbers. Sorry to interrupt. We're watching the numbers because the minute that we can see that there's some relief in sight, we can go for it. It's difficult to predict these numbers. We didn't even see these coming. I think we had 0 in the hospital a month ago. Who knew this would happen? You know, I wouldn't have predicted I'd be saying these things a month ago. So hard to say, really hard to say. Sorry, it's just, this is shocking. But a bigger question is this our new norm? Is this the way we have to live? Are we just going to have to adjust to this virus and this is our new norm? I mean, countries everywhere are facing the same dilemmas and questions. There's no template for this. And we're all following the lead of a virus and responding to it accordingly. And so I don't know what she'll do, but it's going to take time.
Right.
We'll see if this maneuver works. If it works, then good. If it doesn't, then we've got to get a new plan to knock this down.
Right. Annette,
And I don't know what that will entail.
I was looking at the SITREP last night, and there were the JIC release, and there was a number there that caught my attention. It was 0, as in public health had run 59 tests. Right? Did you see that, Annette? I'm sure you did.
Yeah.
Yeah. Ran 59 tests with no positives. What can you tell us anything about that? Because people will see that and they'll be like, oh. I mean, but there were 43 other positives in other labs, right? But I just was wondering if you could tell us more about that.
Again, we're testing. We're recommending testing for all known contacts, and so it's good to see that there are several that are negative, or a big number that are negative. But unfortunately, yes, we're still seeing positives being reported by our partners. The numbers are lower than last week, thankfully, but it's still double digits.
Right.
And from yesterday, so we've seen it slowly go down, even from the week before. Last week was lower than the week before. This week so far is lower, and so we want to continue that trend, but we are not out of the woods by any means. We would love to go back down to 0 and single digits consistently, but again, it's a little too early to tell. We don't want anyone to let their guard down yet, because again, it takes 2 to 14 days before symptoms appear. We have individuals who have no symptoms at all, testing positive and going around, and so that's of concern. Is we don't want to reverse course and then we get hit again with another surge and we haven't fully recovered from this one. The hospital hasn't cleared out the patients and had some breathing and recovery time, because yes, this is very taxing. I have my communication as well with GMH, and so it's just been nonstop for them, and so again, it's too early to tell. I like to see the numbers continue to go down and continue to see less positives being reported out.
Right.
But again, some of the stories that my investigators are getting from people they're interviewing is concerning. It goes back to what Dr. Manglano was saying about, social distancing and everything. But the biggest part is stay home if you're sick. Just last night, right before, one of my last investigators talking off of the day, oh yeah, my coworker was coughing right with me the last day I went to work. I'm like, oh, okay. So, you're testing positive and you're telling me the last time you went to work, someone was coughing and sneezing nonstop. So that's concerning, that people going to work knowing they're sick. You don't know if it's the flu or is it COVID. And so that just makes our job much more harder, because the exposure is still ongoing out there. You may not know you're positive because you didn't get tested yet, but then now we're backtracking when we find out days later that, yeah, you are positive, and now we have to deal with household and your work contacts because you didn't listen about staying home, covering your cough, wearing your mask, social distancing. And so it's just continuing like that.
Yeah. We're I think this is week 3, right, Chris? Week 3 in the stay-at-home order. This is week 3. At what point can we tell whether or not, I guess, the stay-at-home order is working? Is it too soon to tell? Is that what you said?
It's too soon. Yes, I agree with Annette. It's too soon.
Okay.
We need a little more time to watch these numbers, and we're watching the overall numbers. And Dr. Cabrera is gracious enough to keep those tracked, and then our epi team the same. And then we've got to watch the hospital. Again, I don't care about the numbers. I care about the hospital.
Yeah.
If we're at 0 in the hospital, that means everyone is doing okay. But when we go from a death, a total of 5 to what are we, 19 now? It's and they've all come in the past few weeks, the bulk of them. Until we see that go down, you all will know. You will see the trend yourself. And when you start feeling like, we've got breathing room, that's pretty much where we'll feel the same. Mm-hmm. And as far as testing goes, everyone knows we had a major backlog when we tried to not turn anyone away. And Annette can comment on this a little bit more. So now, will we still be doing testing? Yes. But we've decided to control it to limit it to the capacity of the lab, so that we don't overshoot their capacity to do timely testing and timely notification. And then we're doing targeted testing for contacts. And so those are the 2 paths we're using for testing at this point in time.
Okay, so hospitalizations, the number to watch then, and it doesn't look so good. So the likelihood of extending this stay-at-home order,
unseen damage,
it's pretty likely.
The result of the COVID. I mean, that people don't see that.
Mm-hmm.
So
we've been talking about how serious it is at GMH.
Yeah.
I mean, every time we talk to Lillian, it's just so heartbreaking. So
and just to emphasize, like Dr. Manglano mentioned prior, this disease knows no boundary. It doesn't discriminate. And it's really concerning because we seeing some of the reports from GMH, different ages going into the ER, different individuals, age, background, or health condition, but shortness of breath, the fever, the different symptoms that they're experiencing, but just the fact that it's a wide age range is very concerning. And so people, especially those who feel young, that are young and feel healthy, please don't take it for granted. And again, it like Dr. Wen mentioned, you may be okay, but how about your mom or your dad or grandma, grandpa, or a family member who has a medical condition? That's who you can be protecting, even if you're perfectly fine and healthy and you work out. But it's really those who have weakened immune system that we are very concerned for. And then the numbers coming in from GMH, it's a wide age range, and it's just very disheartening that yes, our brothers and sisters at GMH are overwhelmed. They are just I don't know, they're just amazing for what they're dealing with and pushing through. But again, it is just to put that word out. It's any age.
Mm-hmm.
You should be concerned.
Yeah. And Annette, I know young people who work out all the time, very healthy, were in the ICU with COVID. So I mean,
COVID
it's not.
doesn't care.
Yeah, it's not just their
COVID
other
doesn't care.
relatives. Yeah.
I want to point out something else too. I don't know if you can see that. It's a little graph, and negative, positive, negative. I've had some people say, "Hey, I tested positive, and I went to a different clinic," or "I tested positive. I went to a different clinic, and I was negative. I think I'm not going to go back to that other clinic." And I said, "Hold on, that's a natural course. If you read the book, and if COVID does what it's supposed to do, if you catch it early in its cycle, you will not have enough virus load to test positive. So you'll be negative. And then if you catch it in the sweet spot in the middle of the curve, you will be positive. And then shortly after, you should go back to negative again. So please know that you can believe your test. That's just the natural course of it. Now, some of the people out here don't test negative, and they come up positive, and it just stays positive for a while, because that's what I use your word over and over. The crumbs
Right.
that are left behind may still be around, and you'll test positive. So there's no evidence to show that you're still infectious, but it can happen, but we don't get as excited about that as we did early on.
Right.
We kept someone in isolation for like 60 some days, I
Right,
think,
yeah.
because he kept testing positive.
Yeah.
But then they came out and said, "Hey, the studies are showing it's not infection, it's not a reinfection, they're not infectious. They can go ahead, but it's just the machine picks up the leftover virus,
Right.
and it doesn't know any better." So just to know that it's not the clinic, it's actually the COVID.
Yeah.
So
I guess
and one day can make a difference. One day you can be positive, negative within a day's time. It depends on where you catch it in the curve.
Wow.
Yeah, and so I guess before we let you go, where are we with the serology study? Or I think we kind of mentioned that a while back.
I'll let Annette talk about serology study and surveillance, but I want to say serology testing is not advised or recommended by the CDC for individual cases or making clinical decisions. It's not a very sensitive test. A lot of bugs in that one, and it's not used for clinical guidance at all. For example, you may have COVID, and then your serology may be negative. No surprise. That's why they're advising against using it for those types of purposes. So please don't get a serology test.
Mm-hmm.
They don't count. They don't clear you. They don't anything you. If you do have antibodies, okay, but it doesn't tell you. Some don't tell you the early antibodies to know if you're acutely infected versus old antibodies like you had it 2 months ago. We don't need that. I mean, you really don't need it. Maybe somebody wants to do it for academic reasons, but it does not clear you. Please do not get one. Please save your money.
Correct. Yes, serology is only for surveillance right now. And so that discussion we've mentioned about a project that is still in the works with University of Guam, a partnership between Public Health and University of Guam for surveillance purposes. However, it still has to run its course because we are working with the university. It would have to go through the institute, the IRB approval, Institution Review Board, to make sure everything is okay. And so then that will be planned for launch later on down the road. But again, yes, it's for surveillance.
Okay.
It's not for diagnosis.
Yeah, no, I thought you had
actuality-
mentioned there was a study that was in the works. I
Yeah.
just wanted to get an update and see if that was
Right.
if there's been any movement.
Right. And part of the plan for that serology study would to actually go back and test the known positives.
Mm-hmm.
Because then we want to see too how long are the antibodies still in your system, because that's something that's of interest around the world, is how long will someone be immune. So again, like Dr. Jana mentioned, this is not for diagnosis. It's just to see for surveillance purposes. And again, it's not what we're using in regards to testing you to find out if you are positive or negative for coronavirus.
Right. And it's sort of academic right now. Surveillance, what do we mean by that? If we can study 50 people and do serology on them and say, half of them formed antibodies. Good to know. Are they protective? We don't know. Right now, we think they may be protected for about 3 months. We don't know why some form them, some don't. It's just a head scratcher right now, where we look at it and we get a piece of the puzzle and go, look at this. It doesn't mean anything clinically at this point in time. And we're finding now that some cases, I think Nevada, Hong Kong, we mentioned this before, Chris, somebody came back and had a new infection with a little twist on the original strain. So Will you form antibodies to that? I don't know. It's very academic right now. So if you think you're going to get somewhere with that, like a clearance or rule out disease, we're not there yet. So save your money for now. Hold that thought. Maybe next year it will be different, but at this point, no.
Closing thoughts, ladies. But thank you again for your time. You spent nearly an hour with us. We appreciate it.
Thank you.
For a lot of insight. So I guess
Thanks for giving us a platform. We appreciate it.
Thank you.
Yes.
So last word
Yeah,
to the
stay safe, Guam. Yeah, just please stay safe, Guam. Wear your mask. Stay
Your
home,
health is in
please,
your
if you're
hands.
sick.
Yes,
That's right.
Your health
And we
is
need
in
your help.
hands. Yep, we need the community to help us.
All right.
Thank you.
Thank you, ladies.
Be
Thank
safe.
you.
Stay
Stay
safe.
safe.
Stay safe.
Y'all come back, you
Have a
hear?
good
Bye, y'all.
All right, there you go. Dr. Janet Maglotnia and Annette Huggan from the Department of Public Health Social Services. Again, I got to give my thank you to the acting director, Art St. Augustine, who's is confirmation hearing tomorrow?
We're still having a confirmation.
I don't know. I thought I saw
Probably
something
maybe.
like that.
I know there's an oversight hearing.
Right.
For
So
Parks and Recs.
thank you very much to the director for giving us the access to those. And you got to have that public health presence in the midst of a
Yes.
public health pandemic. It's 8:17. We're coming back with the superintendent of the Guam Department of Education, John Fernandez, next right here on The Link. It's The Breeze 93.9, proudly brought to you by Calvo Enterprises, IT&E, and First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information
What are the
you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Hafa, my name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers of Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
It's The Breeze, 93.9, 637-0094. Always open phone lines anytime you want to call, share a tip, or share a story. And let's just go right to the phones right now where we have this gentleman standing by. And I know you don't want to give your name, but just in talking with you on the line, sir, you told me that your daughter tested positive for COVID-19 on Saturday, and she's currently admitted to the Guam Memorial Hospital and not doing so well, sir. Really, our thoughts and prayers with you on that.
Thank you.
So just give us the situation, if you could, sir.
Okay, again, she was rushed to the hospital by her clinic, tested positive on Saturday. For the four of us remaining in the house, we only today did we get a time for testing. Where I'm calling you actually. I'm in line right now waiting for testing, but my thing was she's a positive, admitted, and I've been telling people on the phone that I'm a dialysis patient. I they have to do something for me, at least getting tested. But again, like I said, only today. So contact tracing. That's bullcrap, because up until yesterday, which was Tuesday, these public health officials are calling my house asking to speak to my daughter. How could they not know that she's been admitted? And why are they calling, why are they calling me at home looking for her? That's just what I wanted to put out there. I want to say that some health officials are blaming the general public for the problems. There lies the problem in this contact tracing. I'm not saying me and my family situation is greater or we're more important over other people, but given my situation, my health condition, I feel that public health should have taken better attention, paid better attention to my pleas of at least getting my family tested.
So, sir, could you tell us a little bit more about the communication you've been having with public health since your daughter tested positive?
Okay, on Saturday, it took them well into Saturday evening to start calling, and they're asking me all these questions where they should be contacting her because she's the infected. But my point is, they keep calling my house looking for my daughter. How could they not know where to find her? When she was tested positive, GMH should have made the proper calls to public health to notify them of my daughter's situation, correct? I don't know if I'm wrong or what, but...
No, we hear about this lag in communication between departments all the time. It's unfortunate. Yeah. So, sir, as a dialysis patient, I mean, you're in this category. We just had a couple doctors on, and
exactly what prompted me to call, because public health is just not. I mean, okay, granted they're overwhelmed, but what are these tracers for? When they should listen to individual cases as they're calling and assess the family's needs as they arise.
Sir, how old's your daughter?
23.
23? Was she experiencing, I guess she was admitted to GMH, so she must have been experiencing complications. Did she have any other
on Wednesday last week from the clinic, they told her, go home, take Motrin, and rest. Stay off of work for a couple of days. Saturday comes and her symptoms are worse, just like really, really bad flu. Body aches, temperatures, coughing, sore throats, but no fevers, no high fevers. And then when we took her to the clinic on Saturday, and then all of it happened so fast that she's being bused to GMH by ambulance. And then when she finally got there and had the test done, she had called us and notified us that she's positive. And said, oh my God, I mean, this all happened so fast, in the blink of an eye. People out there are taking this thing lightly, and they do not know what it feels like when you're sitting at home and you have a loved one and you can't be with them. Thank goodness for technology and FaceTime and WhatsApp video calling.
Right.
Because that made it a little bit easier.
Sir, I got to ask you, because you just said people aren't taking this seriously, and I totally agree. You said it's because they don't know what it's like. So please tell us what it's like.
It's hell. Pardon my language. I can take falling off a 10-foot roof over this any day. But not being able to reach out and comfort your daughter who's crying because she's afraid, she's in pain. They were constantly drawing blood from her. She has to wear this CPAP mask because of her breathing. I can go on and on, but I'm not gonna. I just want to say to people out there, this is some real stuff. Take it seriously. Take it like the person next to you has it, because that's what happened to us. We had no idea it would happen. And being that I am a medical patient, we were extra cautious with what we did, where we went. We masked up, we sanitized, we social distanced. We've told family members, please, in so many words, stay away. If you want to drive up to my driveway, we'll wave to each other and then call me. But we took the precautions, and it hit us like a wave, tidal wave.
And so your wife, and you said there were 4 people in the household, right?
Yeah.
And so
my 2 sons.
You have 2 sons. So
Yeah.
when are you guys getting tested?
I'm in line as we speak, waiting to get tested.
All of you?
Yes. It was when I threatened to take our experience and come on your show, and here I am. Only then did we get somebody to call us to schedule for today. Just yesterday, mind you. But it took me threatening them to take this to the airwaves, and boy, oh boy.
That's unfortunate. It would have to go that far.
I know. I mean, unfortunately, it is sad, but it's true. It happens. Me and my family were living experience of it. So we want to prevent anybody from going through this situation. Just stay safe and take the precautions you need to stay COVID free.
Well, sir, we're wishing you the best of luck. You can message me on any of the social media stuff. I'm pretty sure you can find me, and keep us posted, because especially as a vulnerable dialysis patient, what these doctors have said this morning is if you test positive, you're going in the hospital for 14 days. No ifs, ands, or buts.
Yeah, I'm praying. I come back negative. I was tested about 2 weeks ago for a possible contact, and I came back negative. But this one's a little bit different because she was in my own house, so I'm just keeping my fingers crossed.
Are you guys feeling any symptoms or anything?
Fortunately, 4 days, 5 days later, no. Fortunately.
Well, you're in that window where if you did have it, you'd start to be experiencing. I mean, if you were symptomatic, you'd start to be feeling those symptoms.
Right. But everybody knows. Nobody knows what really goes on. One case is always different than the next.
Right. Yeah.
So I'm just keeping my fingers crossed. I want to shout out to the staff and medical crew at GMA for doing a tremendous job, and we're so thankful that they're taking care of my girl. And everybody over there too.
I got to ask you, sir, with this news, this investigation that, people may or may not have caught COVID at GMH. I know the staff is hardworking, but does that play into your thoughts and your feelings this morning?
No. I mean, if they're there, if they went in for it, what more can they catch while they're there? See what I'm saying?
Yeah.
And if they're there for not having COVID and they get it, I mean, they're in an infectious environment. It's up to the staff to prevent for the staff members and for incoming patients. So her being at GMH doesn't have a bearing on my feelings. I mean, I think she's in the best place she can be, getting the best care that she can.
Well,
Okay,
our
so-
prayers to you and your family.
Thank
with
you.
everything.
And again,
Thank you very much.
to recap, 23-year-old daughter hospitalized at Guam Memorial Hospital, COVID-19 positive. She was struggling. She's on the oxygen. And just, again, sir, like you had said, people got to take this seriously. And we're praying for you and your daughter, your family, and everybody. Just prayed last night for everybody who's been touched by this deadly virus.
Amen. And thank you for getting my story out there.
Of course, sir. Anytime. Message
God
me.
bless you guys.
You can find me on Facebook.
Let us
okay.
know.
Yeah.
All
Keep me
right, you
posted.
got it.
Okay, yes, sir.
Okay.
Okay.
Yes, sir. Thank you.
Miss a link, miss a lot. It's 8:33. This is The Breeze. We'll be right back with the Superintendent of Education, John Fernandez, next. Good morning.
We're celebrating your special day every day with Cold Stone Creamery. Register your loved one for the Cold Stone Creamery.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
very sobering message from the guy who just called. Didn't want his name out there, but man, that's crazy. I was praying last night that please give people understanding to take this thing serious, and it's just been one after the other happening this morning from Dr. Hoa, who, of course, had his sobering comments. Dr. Manglotnia from Public Health and Ned Huggan. And then that call is a man this morning is waiting in line to be tested for COVID-19 after his daughter tested positive.
Him, his wife, and his 2 sons.
Right. And he's a dialysis patient, one of the at-risk, very vulnerable people that just this morning we were talking about. And if you're a dialysis patient and you test positive for COVID-19, you are going to the hospital for 14 days at the very least.
And there's like 50 people, right? That was the census
Right.
over at GMH.
53.
50 hospitalized at the Guam Memorial Hospital. And there's 2 over at GRMC. And that's because they just don't have enough room for ICU level of care
Right.
at the Guam Memorial Hospital. So it's more than serious. It's critical over the Guam Memorial Hospital. And you heard it from Dr. Manglotnia. That's the number to watch,
Right,
the
those-
hospitalizations.
Those are the facts right there.
Mm-hmm. And if these hospitalizations continue to peak and continue to stay on this track, then we're going to be in this stay-at-home order. We're going to be in PCOR 1 a lot longer than Friday.
And one of the things that the doctors had said was they talked about the number of people on the ventilators and the percentage. 36% of people on the ventilators are likely to die. That's the kind of stuff we're unpacking this morning on the link. 8:39. Let's just go to the K-Wave News Zoom room and get right into it with our education update. We get them every week on a Wednesday. Thank you, Superintendent John Fernandez, for jumping on.
Hey, thank you, Chris, and good morning, you and Bree and the team over there. You're absolutely right. And I'm just listening to the show earlier, and again, just over the last week, as we've seen the fatality numbers go up, it's been very, like you said, I think the word was sobering. And I've always, I guess cautioned, our team is that, we're such a small island, and GDOE in particular is such a large agency that it doesn't take long, within the community to have these positive cases start to impact our own, employees, which we've seen in terms of the positive cases. And then yesterday we were informed that one of the fatalities was actually one of our recently retired teachers. Someone who I just met earlier this year. I mean, just recall just meeting and talking to earlier this year at a retirement ceremony we had. And so, it doesn't take long for it to hit your families, your colleagues, your friends. So, we hate to share the news, but I've been, knowing, we got to know that it's, before too long, because of the size of the agency, you're going to soon have to report, this type of information or confirm the information or, be impacted by the information. So we do pray for everybody who is being affected, those who've been diagnosed positive, those who are in the hospital and ICU on ventilators, but everyone, also the families and friends of everybody who's affected. I think I also have been talking about the situation at GMH, so much wanting to help the front lines. But over the past week, we've had to send, approximately 16, 17 nurses from their school nurse roles and make the assurance to them that they're going to have an opportunity to get orientations and trained and be a part of the non-COVID-19 teams before they get thrust into anything further on the front lines. But, getting the news back that, the GMH is struggling as well to address positive cases that may be going at the hospital, makes these decisions so tough. So, I'm with you, just learning about the news over the past week and seeing those numbers rise. It's really important we get this under control.
Yeah.
All right, on to education. I mean, gosh, it kind of seems like an afterthought with everything that's going on, but the department still educating kids in the midst of this PCOR 1 lockdown, John. So we'll just go status update generally, and then I know Bria has some questions.
Right. So I think, as you know, over the last week, we've been able to restart the hard copy distribution for our students in the hard copy model, and that's been, again, that's doing that in the midst of the anxiety levels rising. We're so thankful to teachers and staff who've been able to to go in, practice their safety measures, and then go ahead, restart the hard copy distribution, which we know is important to many students who are not online. In addition to that, maintaining the online learning model as well. That's been going on, has not been interrupted because of this, further shutdown. In fact, we've been doing a lot of parent meetings. We continued it, started last week, continued it last night, just to get input from parents as to how to improve, the scheduling of these online classes, how to improve their access to information, and so forth. So those have been going really well. During this pandemic situation. It's really the I guess the toughest issues are about, the facilities and being able to return to facilities, because we did start not only the hard copy distribution, but, there's been such a demand for food that we went ahead and started not only the commodities programs, which we're so thankful that the mayors are handling for the most part, but also Friday distribution of non-perishable breakfast items that we were able to get out to our students as well. So, it's just a really tough balancing act between delivering distance learning, but knowing that you have to be at campus to also provide additional supports to those students who need that. So that's what we've been doing over the past, week since we discussed it. And, again, with the rising numbers, it doesn't mean that everyone's going in and feeling comfortable. We do have a lot of questions, a lot of concerns that we're hearing from our teachers and staff. We're working hand in hand with the Guam Federation of Teachers to get a handle on those questions and to try to provide responses and information. And we'll just continue to do so with the hopes that we will see this situation start to ease back towards towards more towards lower numbers, I guess.
Right.
So we're looking forward to that.
John, I wanted to ask, and I don't know if it's specific to an individual school, but students with special needs and picking up the hard copy, just hearing a lot of things from different parents of these students that there have been mix-ups in the packets that they're picking up. Can you address any of that? Is that a real issue?
Well, again, I think that's probably going to happen from school to school. I mean, this might be an issue for a particular school versus general. I mean, last night when we spoke to our secondary parents from our central schools, we had good feedback and positive feedback from some of the schools in those areas. So I think it might just depend on the schools and the teams and those families. So what we do have on this Thursday, we do have a session dedicated only to families and parents of students with special needs, so we can kind of focus in on what that experience has been for them. I mean, we know that every student is going through this situation, every family, but for our students with special needs under our SPED program, we know that those impacts may be more, even more significant. And we wanted to make sure we dedicated time just to understanding, the supports and services and how they're playing out in this distance learning environment. So I just encourage any parents who have those questions or concerns, join us for our session on Thursday. It starts at 5:30 in the evening, and it usually goes until about 7. And what I'll have our public information officer just repost the remaining sessions and times on our DOE Facebook page, so that families can go there to get the Zoom link or watch it on Facebook Live if they'd like.
John, I noticed that there was a meeting yesterday. I believe it was the Guam Education Board. I believe it was about the budget. Is there anything you could share with us as to what was discussed?
Well, even in the midst of trying to get the school year started, we still have our responsibilities to address the budget. And at this point, we know that the legislature has passed a substitute bill, and that the governor is reviewing it and determining whether or not she will sign or veto it or allow it to lapse into law. And we've heard some of the concerns that have been expressed, from the front office. So we are waiting for a final determination on the budget and the governor's decision. But in the meantime, the board has to prepare itself as well. When the final budget is completed, the board then has to approve a spending plan for the department before the start of the fiscal year, so that we can align our budget along with along the lines of those priorities that the board is setting, which again in line with the final budget numbers. Right now, we're looking at about a $14.5 million cut. That's a 7% reduction from last year, and it also represents over $30 million cut in our budget since FY 2018, which was the year when the federal tax cuts, first impacted our local revenues. So the government, we've gone through a series of major reductions and cuts over the past couple of years. So digging deeper is going to be very tough. Now, of the 14.5, 2.5 of that is expected to be reimbursed to the department once our JFK lease or JFK bonds are refinanced. So, but at the end of the day, it's still going to be about $12 million that will be short this year compared to last year. So that'll impact us across the board. Of course, we're looking at where we can get additional savings. One of our board members, recognized that if we don't go back to face-to-face, there may be opportunities for savings. But having said that, our goal is to return to face-to-face classes if we have the opportunity. So, we're just going to put us in a really strange situation of trying to manage the budget and deliver education services if we get to a point where we can go back to school in the traditional way. So those are some of the discussions we had just to prepare the board for understanding the breadth and the scope of the cuts that were being made in the substitute bill that was passed.
Wow. $12 million? $12 million.
Yeah, this is on top of the $19 million that we've cut since 2018. And I think as when we made those cuts, we were out in the community just to let the parents know that this is coming down the line and trying to forego expenditures that we could live without. But when you cut on top of that, now you're talking about how do we make sure that we don't to see if we can avoid impacting the livelihoods of our employees.
Right.
You're looking at what else you can do with utilities, and I think as a board member said, if we're not at the schools, yeah, of course we'll see some utility savings, and that'll help. But at the same time, you don't want that to drive your decision about whether or not to return to school when the time comes, things
John,
like that.
It's got to be a tough conversation with your oversight chair. Although she's on deployment, yeah, I'm still getting paid to be a senator. But what was that conversation like, if any, that, hey, Leche Vice, $12 million?
Yeah, I think at the end of the day, we dealt with her. We dealt with the appropriations chair as well with Joseph Augustine. I think the message to us is really, across the board, everyone's taking a cut, and I think we understand that in this revenue situation, we understand that every agency is potentially going to see reduced expenditures. I think our board's point last night was, with education being a priority, shouldn't education have been the agency that, or that's along with public health and our public safety agency, shouldn't we have been shielded from some of these cuts? And I think those are the questions raised by the board last night. And I think number two is, if the governor is reconsidering a budget, and if she puts in place a process for the legislature to reconsider a budget, I think the board was really saying, okay, you know what, if that's the case, please give reconsideration to the Department of Education, to education as a whole, as a part of maybe a new compromise with the legislature.
Right, and
we can't ask for any of that surplus.
Yeah, I don't know. I don't know if that's already been utilized. I know because we're running into accumulated debt situation that has to also be addressed. So I've heard that discussion between the legislature and the governor. Right. For us, all we're trying to do is make sure that from this current year that we pay our bills, that we provide services to our kids, and then to know that next year, the year following, we're going to have further reductions. It's really going to make us go back to the drawing board and figure out where else can we cut and squeeze at the same time that we're trying to make sure that our kids are safe and we can deliver educational services during this pandemic.
Right. That's but if we have a surplus, in this pandemic, who hasn't not paid the loan, not paid the car, so they could put food on the table? We're all struggling with these tough decisions. And we heard about public health, and it was a case of first cut is the deepest, with the lead agency in this pandemic getting gutted. Now we're finding out the second cut even deeper. It's education.
Right. So I think, what we're waiting for is the board really is going to come back in maybe a week and a half to go further into some of the budget options. We're waiting for the governor to take action, make a determination, and then see where we end up. But before October, the board is really going to have to sit down and outline areas that need to be cut, need to be maintained. We're going to provide them options as much as we can. But last time we looked, unless we're shut down for the school for the full year, last time we looked, we're getting deep into the bone now, with the cuts that we have to make. So, again, in a week and a half, hopefully we'll get more information, and the board will be able to sit down and start talking about, where those cuts will take place.
Well, yeah, it's serious when you're one of the options, and one of the things you're talking about is like, let's cut face to face. That's bad.
I almost feel like you should just throw this budget back at the senators, back at Adelup, and just be like, here, you tell us how to work with this bull crap. Show us a way, because we don't see one.
Absolutely, Sabrina, one of the board members, said, so what happens if we don't go back to school? And I said, well, we will run that scenario in terms of a budget. What will happen if there's no face-to-face? But again, you don't want to have to drive that decision by, your budget. You want to drive that decision based on whether it's safe to come back to school, and you want your kids back with their teachers and so forth. So, that's going to be a tough discussion that we're going to have in a few days, within the next couple of weeks.
Any more bad news,
good
Guam?
luck with that.
You got any good news, John?
Yeah, you got any good news?
Shining stars in the department?
Well, again, I think a lot of questions we've got, whether we've received, is about the online, distribution. So we do want to let the parents know it is coming. Beginning next week, we will start with the application process and hopefully the distribution process to those families, the secondary school students. We're going to start at the secondary level, and we are going to be focusing on trying to move some of those hard copy students into online. So right now it'll be equipment. We're working with the governor's office and our own funding to try to do some expansion of internet access as well. And but that'll be the starting point. Next week we'll start that process with the outreach to families and get that going. So for those who are trying to manage in this hard copy environment, we hope that it'll change for some of our families who are able to take advantage of the laptops and equipment going out. And again, start from there and keep growing that program, which I do think will bring benefits to the school system once we get familiar with further familiar with the online program. So we're looking forward to starting that as we get into next week.
Just an update on the commodities and the grab and go meals.
Yep, commodities are going through the mayor's offices, so please, we encourage you to call your mayor. They've been very gracious in saying, look, let's take the commodities and we'll handle the door-to-door distribution to our Manomco, our disabled, and then also to doing drive-through operations for their residents. So please have residents call their mayors directly, and those mayors are working with us so that they can spread the commodities throughout the island, make sure that they go to those who are in need. On the school breakfast program, the school lunch and breakfast program, we are again doing Fridays at every school, distributing non-perishable items so the kids and the families can take home. So all you need, you will need an ID and to have the name of your student, at that school, so they can check in that student off the roster. But then pick up the bag of commodities and the bag of the non-perishable food items, and they'll have that for the week.
All right.
So that started last week and should continue for the foreseeable future.
All right. Thank you, John.
I just wanted to say, though, you got the Guam Education Board. That is a huge election. I didn't realize it was going to be this big. There's only, 6 seats that are up for grabs, and you got 10 people running.
Wow.
Dr. Mary Okada?
Huh? The president of GCC?
That's Dr. Mary. And she was also, wasn't she part of the transition committee for
John, you know what it looks like to me is it looks like the Adelup is trying to stuff all their people into
Robert
the board of education
Chrysostimo,
because
Alexander Duenas, Peter Alexis Ada. He used to be on the board.
Right.
And Salvador Avila. He's a familiar name. Was he ever on the board before, John?
Yeah.
He was on the board before?
No, I don't believe he was on the board before, but we do. I think last election there were four candidates running for 6 seats, and this election there are 10 candidates. So we're doing things. I'd rather doing things really poorly or really well.
That was to me.
What a good sport.
Dr. Mary Okada. That's interesting.
That's a little, that's interesting.
Then you've got the incumbents, Mark Manjola, Maria Gutierrez, Lawrence Cairo.
I just got to say that I appreciate the board chair, Maria Gutierrez. I think it's clear that, she stands for the department, stands for the kids, even if that means standing against the administration. There it is.
And I'm just because I know Mark, he really does care about the Guam Department of Education.
Right.
So what an election that's going to be.
Ooh, feisty. John, thank you. I know you want to say something, but don't, okay? You might get another $12 million cut. Thank you, John.
Take care, John.
Absolutely. Have a great morning.
Yes,
Be safe.
okay. Wash your hands. 8:58. Let's just keep it in the KUAM News Zoom room and flip on over from the public schools to the private school side where we have joining us. And hey, I'd love to get other private schools on.
Yeah, we should probably get like St. John's. I know
St. John's.
Your mom's teacher there. We can
Right.
get them
Okay. So we don't have to get them on. We could if you want, but we do have in our KUAM News Zoom room Jeremy Zychek from Harvest Christian Academy and from the Catholic schools. He is the superintendent of those Catholic schools, Dr. Juan Flores. Good morning.
Good morning.
Morning.
All right. Let's start with Jeremy. Give us a progress report. How are things going over at Harvest Christian Academy?
Yeah, thank you. We are 3.5 weeks into online education at the moment, and things are going well for us. Right now, we're working with parents and students that are starting to accumulate screen time fatigue. If you remember not too long ago, parents were worried about screen time and obesity and being inactive, and that's exactly where we're at right now. And just have a limited ability even to really go outside and exercise and those sorts of things. And so we're trying to get creative with some scheduling, continuing to make progress educationally, but also trying to balance those things, the physical, the social elements of education, which are really, really important. And as John had mentioned just a few minutes ago, I was really happy to hear that the goal is still to return to face-to-face education because it's just so important. And I think our kids are struggling now. We've seen, different reports in the newspaper, even about suicides, and just the difficult time this is for our island. And the case numbers are high, and man, it's really challenging. But we continue to pray for this island. We pray that the cases would reduce, and that very soon we'd have the ability to come back face to face and just connect holistically as we need to with our students.
What are your students and parents saying, Jeremy?
We're getting ready to release a survey here this week, and but anecdotally, the feedback we're getting from parents is they're very grateful for the opportunity to be able to continue education. We also have been hearing from parents just the economic impact. I mean, I think we understand as businesses are shut down, there's there's less and less ability for people to make a sacrifice educationally from a tuition standpoint. For their students. And so we've had a number, we're down about 15% in enrollment from the standpoint of parents that have decided just economically they can't, or they've chosen, another method of homeschooling their child. And so, as John had talked about, just the educational cuts for Department of Education, I'm not sure if Juan's dealing with the same thing, but we have similar, challenges as we deal with budget and just smaller numbers at our school as well.
Right. And let's go over to Juan, and we'll just expand on what Jeremy had just said. Juan, are we seeing a drop in enrollment and tuition money that funds Catholic school education?
And so for some of the schools, there has been a drop. I would say overall, we're probably 10% below where we were last year. And so, but much of that we knew at the beginning of the school year, and schools have adjusted accordingly, either by accommodating that reduction in expenditures, not hiring on new teachers if they needed to, doing whatever they can. I mean, the bottom line for tuition-driven schools is you can only live within your means. And while it'd be great if we all had sugar daddies and sugar mamas who are going to write out big checks just for the sake of running the schools, we have no choice, right? Whatever tuition budget we have, that's what we live with. So I think most of the schools are doing okay. I think one of the things that's really critical for all the Catholic schools is we learned a lot of lessons from last spring. And one of those lessons is to respond to what's going to make education meaningful for the students. And I know many of the schools, even on a daily basis, will make improvements. They will respond to a challenge. They will make sure that we don't wait around waiting until there's a really great impact on the students' learning. And in some cases, schools are having to address concerns with specific teachers if in fact they're not meeting the needs of the students. That's the bottom line for us. I mean, I'll be honest, as an educator, I'm not much of a capitalist, but being involved in looking at tuition-driven schools, you have to be, right? You have to say, well, what are the parents looking for? And in the Catholic schools, they're looking at two things, I think simultaneously. They want a good academic education, whatever it takes, and they also want some of the spiritual aspects of what our schools have to offer. And so we've got to make sure that we try to provide that. We've got to make sure too that we continue to build community within our schools. I'm directly involved with one of the schools because we're still looking for a principal. And last Friday we had a virtual assembly. There were 116 kids of the school, and I think we had 90 on board this virtual assembly. And I got to say, the only reaction I had was it was really cute. That, we sang the Star Spangled Banner, we sang Finogi Tomorrow, one of the students even sang the school song, but it was nice to hear the kids speak up. It was also nice to hear the kids, as we were leaving, say goodbye to their teachers. And many of them, I think, show appreciation. It's a challenge. I asked the kids if they'd rather stay home or if they'd rather come back to school. And while some students said, I don't know if they were serious, oh, I'd rather just stay home, I think the majority were sending comments saying, no, we want to come back to school. Now, we were lucky because we had 1 week to develop face-to-face relationships, only 1 week. And I think we're going to try to continue to take advantage of that and continue to improve. And that's true of all the Catholic schools. I got to say that from what I'm hearing from some of the Catholic schools, there are teachers in some of our schools who should be doing the professional development on distance learning, because they're doing some fantastic things, most things that I have never been aware of.
Right.
But they went on their own this summer and they joined seminars and they did professional development. And, we made all the plans because we had no choice. We had to get ready for school to start, and we did what we could.
I wanted to follow up on something you mentioned, Jeremy, about the fatigue that what the students are experiencing and parents. But I also think, what about teachers? Are they also experiencing some sort of fatigue? Because for me personally, I get emails and notifications on this Google Classroom of homework assignments, and sometimes I get them at like midnight, at 10 o'clock, and I don't know if this is just set up automatically or these teachers are actually working these long hours. So have you guys, same with you, Juan, I mean, are you guys experiencing this kind of sort of fatigue from teachers?
These teachers are pretty awesome. They called and feel called to do this type of missional work, and they make sacrifices to do so, from a salary and a benefit standpoint, all those sorts of things. From a time perspective, I have 6 kids, from 15 down to a daughter that's in K3, and I'm constantly amazed at the amount of work and effort that these teachers, and they do it because they care. They are sending emails late at night. They're sending me, an email, hey, this kid is missing a few assignments, and it just blows me away. They're really missionally driven, and they're getting fatigued too. I think, as with anyone, it's not just, I'm amazed again by not just the desire to teach these kids educationally, because that's really important, but we can't forget the relational aspect. And that's how we add a tremendous amount of value. And so after the day is done, these teachers will sometimes hop back on with students that are struggling, because we have to worry about effectiveness of the delivery of the education model. And they'll just spend times with kids in smaller Zoom sessions. And again, it's more screen time, but it's an important connect relationally. And so, yeah, worried as we think about the following year, how many teachers are going to want to come back and say, I don't want to do online education. I want to do face-to-face education. And so I know some of our teachers are struggling with that. I'm very grateful that they're missionally driven. And 3.5 weeks in, I'm very pleased with just their ability and desire to continue to sacrifice their time. It is a personal sacrifice.
I had a comment here, and this is maybe you can kind of bounce it off with the tuition and enrollment drop that you guys have seen from Michelle, and not singling you out, Jeremy, but she put Harvest is one of these private schools forcing kids to stay online for more than 6 hours a day. Kids don't need to be online all day. That's cruel and unnecessary. I know some parents who would agree with that statement. Yeah, and again, I understand it's about the education delivery, but you said it has to be effective. Is it effective in your opinion?
We constantly want that feedback. I appreciate it. We're listening to parents. We need to know from there's a balance. You need to feel like you're delivering the value of education to students. There's got to be a value. It's got to be effective. So what's effective? And, I would say probably from 12th grade down to 4th grade, it's a full day. It's a full day from about 8 o'clock to 2 or 3 o'clock in the afternoon. There's going to be breaks in there in the meantime. But the younger grades specifically have less time because they have shorter attention spans. The principals and I were just brainstorming yesterday what we can do from a screen break standpoint. So we're getting ready to roll out an announcement to our parents. We're going to have a day a week and just see how it goes. Where we have a screen break and, trying to encourage students to not just do things online, but with a pen and paper or just taking a break, period. And so we appreciate that feedback.
Okay, and Chris, sorry to jump in right here, but joining us on the KUM Zoom room right now, a school that we have not featured, but I know you guys were just asking me a couple moments ago, can we get someone from St. John's? So my friends, asking you shall receive, because Bob Kelly is the assistant head of school at the Upper Tumon campus. He also spent many, many years as Bob, career counselor, guidance counselor, kind of sells short just the wide range of activities that you provided for the Knights over there. So thanks for your insight on this, and welcome to the show for St. John's.
Right. And
hey, thanks very much. I appreciate nice to see my colleagues here. We've had a number of conversations over the summer as well between the three of us as well. So
right.
Anyway, nice to join you.
Yeah, and we're just talking about, we were talking about the what one listener commented was excessive screen time. And I want to kind of go back to the enrollment and the tuition issues. So we have parents who are saying, hey, these kids are online more than 6 hours a day. And parents are doing a lot of the legwork, right, which they don't normally have to do in a regular environment. Do you get a lot of complaints about that, or does that have anything to do with the drop in enrollment?
Well, I'd say for us, we have not experienced a huge drop in enrollment. We did graduate a class of 50 kids last year, so that kind of hurt us a little bit. But our enrollment actually is very much within the parameters we were expecting. In fact, we're getting a little nervous when we were face-to-face because we had a few too many there, so we were trying to stop at 15. But I think that, I came in just as you mentioned the screen time question to Jeremy, and it's related to what I'm going to answer here with your question to me, because for all of the parents that say there's too much screen time or whatever, there are an equal number of parents who say, no, it's not enough. And so, you really got to kind of balance that out and kind of figure out that, the three of us being education professionals trying to figure out what works best for our communities. So, we've had, we had a parent offered in fourth quarter, we had a parent call up and offer to pay this year's tuition in advance in case we were short of funds and we needed some help. So, as much as you get one group of parents saying one thing, you get the other group of parents saying another thing. like CNN and Fox. Oh, sorry. That's
So, Juan, have you had any parents just said, "Hey, let me pay the next few years' tuition in advance just to help a brother out"?
Actually, the one school, I'm not getting reports from most of the schools, but the one school I'm working with directly, we had a significant jump in the number of parents who paid tuition for the whole year. And I mentioned that to the faculty as sort of a way of saying, hey, these families are supporting us. But I want to go back to both the teacher fatigue and also the online time. A lot of times what's happening is, even though there's a window for students to be online with their teachers all the time, it's not always direct instruction. Whoops, I don't mean to use that word literally, but in terms of a program. But it's not specific instruction that's taking place, but the teachers are online. So if the students had specific questions, they could ask their teachers, or if they need an extra help. And Bob's right that there are some parents who are concerned that there's not enough time being spent, and then the same number of parents who are concerned there's too much time. And I think, I've had to advise some teachers from different schools who've said to me, they feel like they need to respond to email within 20 minutes. That's why they're on all the time, right? So they're on until midnight. And I've advised them to schedule those times and be honest with the parents, to say, okay, I know you're coming back from work at 6 o'clock. So from 6 to 8, I'm willing to respond to emails or take phone calls, but then they've got to give themselves some time outside of that for themselves, for their families, and just for their health and well-being, to go out for a walk themselves. We don't want teachers to burn out. And I think that one of the challenges with distance education is everybody thinks that all of the concerns and all of the questions and all of the challenges have to be addressed immediately. Well, in face-to-face education, sometimes we have to wait until class is over to address an issue, or we have to wait until the end of the day to work on something. We don't just jump to addressing. And I think we should think about the same thing with distance ed. And many families are very supportive of the teachers and do expect that the teachers might need some time before they respond. But I want to suggest to parents, continue to raise the questions, continue to express the concerns, and then give the professionals a chance to address them in the best possible way. And if there are 20 students in a classroom, teachers got to pay attention to what's best for those 20 students, and then find ways to address the 1 or 2 students that need extra help or special help.
Jeremy?
It's tough.
Go ahead, Jeremy.
Yeah, no, it's good. We need to make little adjustments along the way. I am concerned long term. When you look at the numbers and the hospitalizations, it doesn't seem as though this is going to end anytime soon. And so you have to remember, all the kids in the classroom are not identical. They all have different needs. They all learn a little bit differently. And that's why we have professional educators, so they can do that. It's a little more challenging online, but I'm so grateful for the teachers that invest their lives in this.
And Robert, have you guys experienced any of the students screen fatigue, like we were talking about earlier, or anyone expressed concerns about that?
I've not received I haven't received specific comments. That one of the things that we did do is that we did shorten our day so that we have about 4 hours of live instruction for the middle school and the upper school. But what we've received is an interesting element is, as Juan was suggesting and Jeremy earlier as well, it's the education's different now, right? So that we have shortened our live classroom time, but that kind of means that we're going to have more work, and not necessarily, more homework in that same respect, but if we've taken a half an hour off of class, then the kids can expect a little bit more independent work requirements. So while I've not received necessarily complaints about screen time, I've received people saying, wait, it looks like you're piling on the more work. But I think what's happening is the merger of homework and classwork.
Were you just quoting Sabrina there?
Seems like there's more work.
I feel like you were quoting Sabrina there.
Oh, really?
Yeah.
I'm sorry.
That's okay. She felt attacked. No, I want to give a little silver lining as my public school kids. The teacher now calls every week just to touch base. Never really had that, pre-COVID. So that's one of the silver linings, right? And I mean the workload, it's kind of still the same. I got a boy over at FD. Oh my God, it's like, dude, 9 assignments on the weekend. Let's say. I think they're just trying to give him his high school diploma and maybe like his bachelor's one shot at the end of the school year.
I know some teachers of younger kids, because the kids either don't have devices or there's nobody at home to support online learning. The teachers give the kids some packaged materials each week, and then they call the kids every single day to make sure they understand the assignments, to maybe test them to see if they can recognize their numbers and letters, to do whatever it takes, because first of all, that's what they are more comfortable with, but also they know that the kids don't have somebody at home who's going to help them get on Google Classroom, or somebody who's going to be able to monitor what's going on. That's the kind of dedication that comes from some of these teachers, that sometimes they just have to do that. And I think, when Bob was saying there's a reduction in the number of hours of instruction, in some cases, maybe we have to compromise on how much we're teaching, but maybe we ought to think about the fact that when there is teaching takes place, it's effective and it's meaningful. So we have to pick and choose what we're going to teach and make sure that it's what's best for kids, because bottom line is, from now until, or from 4 weeks ago to the end of May, we need to make sure the kids get 9 months worth of learning. And get them ready.
Yeah, gentlemen, I have a question. As a computer geek, right? Like I'm just watching and marveling at seeing as how a lot of these schools and school systems have put together, this infrastructure of online learning. And Bob, I know you guys over at St. John's, you guys are a Google shop basically. So you guys have the Google Classroom, and and you're with that. And Jeremy, I wanted to get your comments on this, because I remember when the pandemic first started, our Adriana Cotero did a Zoom call with you and a lot of your colleagues over there, and you were actually talking to us that when things really went crazy, you guys were basically building your entire technical infrastructure for online learning from scratch. I mean, you said you had like 2 IT guys, and you guys created like 1,000 user accounts like over the weekend or something like that. So how do each of you feel about the robustness, or like how your systems have held up and everything like that, whether it was an out of the box solution, or whether like in Jeremy's case, you guys had to kind of build it on the fly?
We had a real moving, shifting from face to face with really no warning to, now it's kind of the new normal. We kind of anticipated initially just a bit of a Band-Aid approach, and how can we get this stuff out, and usernames, and 1,000 kids, all these sorts of logistics. We had the summer to improve that. And so I think one of the things we're hearing from our parents is they appreciate a unified platform, a more user-friendly platform, and a unified approach to how our teachers are rolling it out. For parents that have multiple kids, if it's done differently, even on the same platform, that's a huge challenge. And so, yeah, we're I think at a pretty good spot from the standpoint of technology. We've had to upgrade our bandwidth several times here at the school when we've had the opportunity for teachers to teach from their classrooms. Video takes up quite a bit of bandwidth, and we have students that honestly still have challenges. But overall, I feel like technology, been pleased how technology has been supportive of the process. We used to use technology to supplement or augment education, and now it's almost the entirety of it.
Right.
To pick up on that, we're super fortunate. I'm going to give a shout out to Tom Petra, who's our technology director over there. But we've actually been using the Google suite of applications for a number of years. So we had the Google Classroom for 5 or 6 years anyway. So we were it was a kind of a smooth transition for us to just pick up with the Google Meets and move from there. And as Jeremy suggests, fourth quarter, we had a few hiccups, which we ironed out, and over the summer we talked about how best to do them, fix those elements, and then we rolled out this quarter with kind of a newer, fresher approach. There's stories of I was talking to parent whose child has to go to 3 separate platforms at one point during the day. They've got a Zoom thing, they've got a Skype thing, they've got a Google Meet thing, and
Wow.
and you know, even the parent gets a little confused, and so that can be kind of. But as Jeremy also suggested, the single platform is key. I don't care which one you want to use, but the single platform, I think, is probably the thing that makes it easiest on the parents.
Yeah, how about you, Juan? Because I've known you a really long time, and I know that you've always been an advocate of uniformity and having a single standard for all of the education systems. Whether when you were running what used to be the Guam public school system, and now you're in charge of the Catholic school system. So, are you finding that the system is working with both from the teacher standpoint as well as the students to your satisfaction?
Well, in the Catholic school system, what's very different from something like DOE is that there doesn't need to be a need for uniformity. Most of the Catholic schools are pretty independent,
okay.
And I think they need to respond to their families directly. I mean, in some cases, one of the things, in terms of accessibility, one of the things the schools had to do was identify what devices they had on campus that could become available to students. Because there's some families where they might have had a laptop at home, but if there are 3 kids at home, who gets to use the laptop, right? So some schools have made laptops available both to students and teachers, or tablets available to students and teachers because they needed them. And we just prepared for that before the beginning of the school year. The other thing is that almost every school has some kind of, I don't know how to describe it, maybe a help desk, which, we used to use when the internet first started, get a help desk to figure out Microsoft Word and all that stuff. And most schools have that. And sometimes it's for something as simple as, I forgot my password. Can you reset it? Yeah, we're doing it. The schools are doing things like that. And they have to. But I would say that for the Catholic schools, they're probably not doing them uniformly, but they're doing it. They're following what they need to do to be effective for their school communities. And I think that's really important. And it is a big leap for many teachers and administrators to consider that the use of technology is the norm, not the exception. It's not the icing on the cake anymore. It's the cake.
Well, I like cake, and so do a lot of kids.
I used to like cake, but this is just driving me crazy.
Man cannot live on cake alone, apparently, and neither can kids. Let's just go around, Robin. Closing message to the students, the parents of your respective schools. We'll start with you, Jeremy.
Yeah, sorry for the audio. They decided today was the day to bushwhack the lawn. I want to thank teachers for doing extraordinary work. I want to thank parents for doing extraordinary work. This impedes on their schedule. They go home from a hard day of work, or if they're at home all day working, and then help their kids some more. And then students, just want to say, students, hang in, keep praying for an end to this. We want to come back face to face. And we look forward desperately to that opportunity when we can do that.
Bob?
Again, echoing all those things, everybody in this whole process are really stepping up and champions. And I was talking to our seniors last year, and I said, that everybody can come up with an excuse on any given day for anything. Oh, it's too hot, I don't want to do this. But the ones who step up in times of adversity and really, really, really try and go about it, those are the ones who are doing the business. And our teachers, our students, our parents are really, really trying to work with us in this process. I appreciate all the input that everybody's been given, and the product is coming out to be quite a good thing. So I'm very happy with that.
Juan?
I want to repeat something I said to the kids at one of the schools last week. The teachers I wanted to remind them that their teachers are working really hard, that they're doing what they can to provide meaningful instruction and to continue to challenge the students. But I also wanted to say that the teachers are really proud of how well the students have stepped up. That for many of them, they're really showing their best by adjusting to a system that does not really reflect what we should get out of kids, young kids, right? That being social and wanting to relate to each other and being goofy and all those things, that's all changed now. And the teachers in the different Catholic schools remind me that the students are the ones stepping up, and their parents. There's no doubt their parents are making a difference. But I think that both the teachers should know that they're appreciated, but the students should know that the teachers also appreciate them and appreciate their efforts.
Thank you for that.
Thanks.
Juan, Jeremy, Bob, thank you guys for joining. Juan, I just real quick on a private note, I just wanted to offer our condolences. We heard about your loss, and just know that you and your family are in our thoughts and prayers.
Thank you, Chris. I appreciate that.
Okay. God bless you guys and the work you're doing, and be safe, okay?
Thank you very much.
We'll see you guys.
Appreciate it.
Thank you. 9:27, guys. We have to take a quick break, and we're gonna kind of keep on this education track. You didn't know you're in school right now.
Yeah. Yep. God, he's right. The teachers, they really are working so hard, and I get the messages all hours of the day and night. So
sorry, I just like the way you say that. I get the messages all day and all night.
It's overwhelming.
Ah!
It really is, though.
Yeah, I mean,
Can we just take a break?
I didn't get to ask, like, are they going to cut parents a teacher check or,
No,
hey, take a little off the tuition here.
It's and I'm working, so I'm not there with my son as he's taking these classes. He was there. Remember the first week he was coming with me to work?
Right.
And even then, just watching was like, oh my gosh, it's just too much.
I felt bad for him. 9:28, we'll take a break, and we're coming back with, they had a cool program at the legislature, Public Policy Institute, interns, where a bunch of Guam's brightest high school students got to participate in this internship, and we'll find out what they learned from it, the takeaways, and all that good stuff. Coming up next here on The Link. It's The Breeze 93.9. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Hafaday, my name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers of Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
all the time. You had my heart a long, long time ago.
Yep.
In case you didn't know.
Hey, in case they don't know,
You got all
shooting your shot during the COVID.
I belong to you. You're my everything.
9:34. It's the link on the breeze. A little bit of micronation. Kind of keeping with this little country theme that we started this morning, Bree.
That's right.
Yeehaw!
Howdy.
What in tarnation happening around here? Oh, you didn't know I knew about the tarnation?
I didn't.
Yeah, so that's a country. I forget who did the original. Don't really care. The island remakes are always just... I don't know what it is about reggae, but everything is better in reggae. Like, a song could be good, and then when you reggae-fy it, it's like, damn, that's 9:35. Good morning. Yeah, thanks for leaving me hanging on that, guys.
You're welcome.
Reggae haters in here. Cabo Enterprises, IT&E, and First Hawaiian Bank proud to present the link on the breeze, 93.9. Sabrina Salas Matanani. My name is Chris. Do you want to just kind of run through the numbers real quick, Bree, before we get to this last interview, or you want to do it after? I guess I should have asked you that back in the break.
Yeah. All right. So, the latest from the Joint Information Center, it was last night. They issued their report. Sorry, I was asleep. But according to the Joint Information Center, there were 43 positive cases of COVID-19, and that was out of 795 samples. Again, 19 deaths. There was a death yesterday. 1,713, that is our COVID count. 951 recoveries, 743 active cases, 50 people hospitalized at the Guam Memorial Hospital, and 14 of them are in ICU. And there are 2 in the hospitalized at the Guam Regional Medical City because they can't be transported to GMH because they're full.
9:36. Good morning. Let's go to the KUAM News Zoom room where we have interns from the Public Policy Institute program. Good morning. And we also have Speaker Tina Munia Barnes, who kind of spearheaded this PPI. And I guess we'll just, if we could.
Thank you.
Good morning, Speaker.
Good morning, Banana Speedos.
I don't want to say you guys' names wrong, so we'll just go ahead and let you introduce yourselves. We'll start with Mark.
And what schools you guys go to?
And what school you go to and all that good stuff.
My name is Mark Wang. I'm a sophomore and I go to St. John's.
My name is Chelsea Luo and I'm a senior and I go to St. John's.
My name is Sojung Ann. I'm a senior and I go to Harvest Christian Academy.
My name is Isla Rodriguez. I graduated from JFK in 2019 and I'm a sophomore at Brown University.
Wow.
Are you on Guam?
Yes, I'm doing remote for this semester.
Okay.
Oh, that's good. Yay, public schools. Right on. Speaker, we'll start with you, then really want to focus on the kids, but just tell us about the kind of the timeline of the inception of this program and what benefit do you think it's brought to the not just the students that are in it and the interns, but the island?
Thank you very much, Chris and Sabrina, for giving us the opportunity. These students are the interns from the Public Policy Institute Summer Cohort Program, and they are working closely with my office. I want to share with you that they're very hardworking, passionate, and well-rounded students. I'm very, very impressed with the work that they've done over the summer. They are all distinguished. They have all met the criteria of working over 80 hours. As a matter of fact, all of them worked almost throughout the whole summer. And I want to share with you that this group bringing critical issues to the forefront that may not be so popular, these interns took it upon themselves to make sure that we address the emotional and crucial mental fight that people are battling right now, especially during this time of COVID. And Kristen and Sabrina, without further ado, these interns have done a lot, so I turn the floor over to them.
We'll go ahead
And
and
they have awesome solutions.
right, and you know, I was able to see the presentation you guys did on the Compact Impact, funding and the reimbursements from the federal government.
Yes.
Really just very, very insightful. But bring us up to speed on, because I know you had done some COVID-related work. Bring us up to speed on what your most recent project was. And we'll go ahead and just feel free, guys, take the floor. We could start with Chelsea.
Sorry, what was the question?
Tell us about your most recent project and presentation that was COVID related.
Okay, so our presentation was an initiative toward mental health because this is obviously a really difficult time, not just because of unemployment, but also because of the fears of contracting COVID. And it's just a really uncertain time and people need more support. We noticed that in our research, we came upon the local crisis hotline, and we realized that they actually need more funding, and they've needed this funding even before the pandemic. But with the exacerbation of the effects of COVID and isolation and everything else, this is needed even more. So that's why we took it upon ourselves to meet with the director of Guam Behavioral Health and Wellness Center and tried to figure out a solution to help people, provide more support for them through the local hotline. And what they need right now is staffing and funding for that staffing, because a lot of the staff is comprised of nurses and physicians and counselors, and they have other responsibilities on top of answering the phones. So we want to not only help other people who want to call the hotline, we also want to help lessen the stress on those hotline workers.
Mark?
So what we looked at is we identified a funding source in which our project, we would essentially, we looked at the challenges that Guam Behavioral Health are facing right now. And so we identified a potential funding source, and essentially our bill would provide the tools, the resources that Guam Behavioral Health needs in order to fulfill their duties, especially during this pandemic, in providing mental health support for Guam.
Go ahead, Sojung.
Yeah, what is the funding source?
Yeah.
Okay, so with our bill, we wanted to appropriate $400,000 from the Healthy Futures Fund to fund the Guam Crisis Hotline so that they're able to attain dedicated full-time employees. And with our project, our presentation elaborated on different suicide statistics, crisis hotline statistics, and even the National Suicide Prevention Hotline statistics. And what we found out was from this year alone, from March 15, which was the beginning of the pandemic, to August 31st, the Guam Crisis Hotline has received almost 3,000 calls, and we're pretty sure as of now that they have surpassed 3,000 calls. And there has been 26 deaths from January to August of 2020 alone, to specify suicide deaths. So with our project, with our $400,000 that we wanted to appropriate from the Healthy Futures Fund, we hope that that money can go back to the Guam Crisis Hotline and be able to improve their situation and be able to attain more staff members so that they're able to accommodate for all these calls that are coming in due to the pandemic.
I want to ask, what was it like to find, obviously, a very huge issue, and then to discover that there was a way that you guys could help by finding that funding source and trying to get more resources? Because this is, we've talked about, obviously, the public health emergency that we're under, but there's also an economic one and a mental health emergency, as the conversation over the last couple weeks has been about suicide and people needing someone to talk to. So here's an example of the work you guys are able to do to really kind of just go in surgically and get help where help is needed. So what was that like? Isla? Yeah.
I guess for us, like when we were doing our research and finding out this data, even like think what we noticed is that it's actually a lot more common, and it's the statistics are they're increasing because of the pandemic and the issues that people are facing right now. Whether it's about economic security, job security, especially with their finances, and just with this uncertainty alone, there is that fear that that people are experiencing. And when we saw it, because actually from before the pandemic, the Guam Crisis Hotline was receiving only about like 30 calls a month, but that jumped to about 500 calls a month. And when we saw how those numbers significantly increased, but there wasn't enough resources being appropriated for that support alone, we knew that we had to do something. And when we found out that there was a projected overage on the Healthy Futures funds, we knew that we could use this money to possibly fund the Guam Crisis Hotline and hopefully help our people with the support that they need.
Now, something you also did a policy brief, I'm reading here, on storm drainage solutions. Is that correct?
Not as hot an issue as some of the other ones you worked on, but yeah, let's get into the weeds on storm drainage issues, because it's real. We just saw
Tumon.
Flooding in Tumon, flooding in the south. Flooded it.
Chris and Sabrina, I want to say that I don't see Sonny on with us this morning, but his project was he literally made a module to help with the storm drainage to be able to stop the drains from clogging up. And he has the prototype with him, and he looked at successes that are happening. He talked about South Korea, but he talked about a design for the traditional storage drainage that will help stop the overflooding of the sewage backs up. So the water will act as weight that would bring down the trap, and that only the water can go through, and that all the debris that's flowing through to the drainage, that it would stop the trash from going in. So it was a device that we were really interested in looking at, and he has it with him, and we hope to work closely with Department of Public Works and GWA to see how we can look at this project moving forward. And again, he said that it is a module that can be easily made, and that he had a design ready for him, ready with him for us to look at. And he also said that the prototype that he had, if it was to be remade, that it would not cost a lot of money.
And I want to take it back to the interns here. We had a funny comment. Basically, they're doing the jobs of the senators. Legislature, take notes. Mark, no offense, Speaker. Sorry, awkward, but.
I think the entire point for me, at least, I see the purpose of this internship is really to just kind of get into the shoes of policymakers and to really understand how things are supposed to go on in the lawmaking process. And so I think it's just we just kind of get us finding this identifying this funding source and then researching about this problem. I think it's a learning process for us interns, and to really just get an idea of what's supposed to be going on. So I think
So do you guys plan on running for senator in the future?
Yes. Yes.
Raise your hand. Come on, don't be shy. Okay, no.
Okay, yeah. You've seen too much, I guess. You're like, no, we just do this little internship and we're good. Okay, let's go. I want to, because it is a presentation I got to see of the Compact Impact funding, right? How insightful was it for you guys to kind of go into this research? And maybe, I don't know if you were familiar with it before, but far-reaching ramifications of the constant shortchanging of our island at the hands of the federal government. So what was it like to do that research and to kind of say, oh, so that's why everything's lagging and we don't get proper services? Because I loved that presentation. I thought it was key. It was good. So let's talk a little bit about that, because that's an issue again that our elected leaders, just for a variety of reasons, to be fair, haven't really been able to successfully address with the federal government.
Chris, that was the previous cohort that did the presentation of that. This is every fall, summer, there are cohorts, different cohorts.
I guess I should take notes now, huh, Speaker?
I was wondering. I was like, where is he getting all this information?
I lost track of that. Was that last year?
But I want to share, yes, but I want to share, Chris and Sabrina, the importance of this Public Policy Institute. As you know, the 35th Guam legislature did pass this program and made it become statute so that we could give an opportunity for these students and interns to come in and learn on the job training, but more importantly, to have that investigative research skill and meeting with all the different stakeholders, but more importantly, to find solutions. And this is what it's all about. And because that program is now statute, we're hoping that we can create more future leaders. And this is what it's all about. And these guys worked really hard to get into the program. And I'm just happy to know that that these guys have done an excellent job, and I'm so proud of them.
I have a question. Like, how did you guys fulfill this internship? Was it virtually? I mean, how are you able to complete this? Did you go into the legislature? This was over the summer, right?
We did this. We did this when Guam was in PCOR. When Guam was from PCOR 2 and moved into PCOR 3.
Okay.
So for the most part, the policy research, it was done in July.
Right.
So.
I see.
Right on. So let me ask you guys this and tickle your brains a little bit. Was we had a comment. Any solutions from these bright young minds for post-pandemic economic recovery? And go ahead, Mark. You got the floor. We'll start with you, and then just kind of go down the line.
I think obviously this pandemic, it's had a great effect on our economy. I think one of things that we really need to look at, and I'm pretty sure we are looking at, is definitely that this pandemic has taught us that we need to be able to diversify our economy, because Guam, we've relied too much on tourism, and we saw the effects that it has had on us when we depended too much on tourism. So I think it's really long term. We really need to find a way to find sectors that are able to be able to subsidize, or we're able to diversify, and we're not solely dependent on tourism.
Isla?
So actually, when we first started our PPI internship, we actually try to search for ways to help boost our economy, especially during these trying times. So we researched into what can we do to expand on tourism, or what can we do to expand in our economy in general. And we really realized that we need to be able to sustain ourselves, especially when these times are really hitting us the most in our economy. So we tried looking into even agriculture and aquaculture, because we can probably expand on that. And we even tried to expand on trading exports, and that led us to researching into the Jones Act as well. So, yeah.
Interesting. Chelsea?
Right. As Sojung said, we were actually looking into this early on in our project. And I think rebuilding the economy post-pandemic without tourism is like $1 million question that everyone has right now. We were looking at ideas, just how can we diversify our economy, as Mark said. We were looking at fishing, also cannabis tourism, or just tapping the cannabis industry. And I know the regulations are still being developed in that industry, but we're hoping that we can find ways and work with the legislature to diversify our economy and try to bring back some of the jobs that we lost.
Isla?
Like what everyone else was saying, I think the number one thing that we all know, that we all realize, is that we do need to diversify the economy. And to add on to what the other people were saying, is that another area that we looked at was actually the Guam film office, because when when productions come here to Guam to film a movie, there's not really regulations in place for them to pay the government to actually shoot in our island. And because of that, we could have made that money. For example, there was a Netflix film that was filmed there, and we could have made a lot of money from that. And Guam and I think we could also advertise Guam as this like sort of exotic location, because not a lot of people in the world know about it. And that's also another way that we could possibly revive the tourism once everything is a bit more normal.
Interesting. So when we talk about diversifying the economy, right, this is not something that we can kind of stand up by next year. So what short-term moves do you think we can make to simultaneously get kind of back up on our feet and run parallel plans for diversification, Mark? Mark?
So I think, well, obviously, right now, I think we really. Okay, sorry. Can you repeat the question? Sorry.
Yeah, how do we kind of stand back up on our feet after this pandemic and diversify the economy at the same time? Because we can't just like, oh, we're open. Hey, we're diversified now, right? We got to set these policies in place, right? From a policy standpoint.
Yeah, so I think first and foremost, we obviously need to be able to get our coronavirus under control. I think secondly, it's really important that we get the infrastructure in place. Whether that be if we want to develop an aquaculture economy, we really need to make sure that the necessary infrastructure, the foundation for us to be able to develop and grow long term is in place. So I think one of the things that we need to look at is what are the ideas that we want to do, what is that going to take, and what do we need to do now, and how are we going to get there?
So
I think we can also.
Go ahead.
I think we can also look at other countries or states, such as Hawaii, who are kind of in the same situation as us, and try to see what they're doing policy-wise. It's a difficult situation.
I wanted to ask about, you guys took a look at what was happening at the the Guam Behavioral Health and Wellness Center with regards to a shortage of providing money to the crisis hotline. What about over at the Guam Memorial Hospital? Did you guys kind of take a look at what was happening over there? Or even public health?
So when we were doing our project, we mainly wanted to focus on a mental health initiative. Mm-hmm. And with that mental health initiative, we try to expand on helping our youths to even establishing a mobile crisis team for Guam Behavioral Health and Wellness Center. But we found out that they already have one in place. It's just the fact that their Guam crisis hotline wasn't properly established yet. So that's why we mainly focused on helping Guam Behavioral Health and Wellness Center. We knew that public health and GMH are going through a lot, especially due to this pandemic, but we wanted to do something for the people, especially with the surge in crisis calls.
Oh, kind of running out of time here, so I guess if we could just round robin style, tell all the other students out there why they should try and be part of the Public Policy Institute program at the Guam Legislature.
So I guess I'll start off. I think if you really want to obviously kind of understand what goes on in government, you should definitely come to the Public Policy Institute. Also, if you want to really do something that is able to make a difference on our island, I think public PPI, they give you the tools and resources to make those happen. So I think, yeah, for those of you, anyone who just wants to have a really interesting experience, I think PPI is something you should definitely look at.
Yeah, I think it is a great opportunity. I learned so much from working in the legislature and just sitting in on meetings with the heads of several agencies. We actually we paged for public hearings and we wrote an original bill, and we were able to do all of this with the support of the policy team and Senator Tina Munoz Barnes. And they were really supportive. And whatever ideas we had, they were just there to provide support, to push it through, to see it through and help us in any way they possible. And it's just a great program. And if you're interested in policy making or just learning about the government, local government in general, then I think that you should definitely try this program.
Sojong?
So the PPI internship is, of course, it's going to elaborate more on government, but it can also elaborate more on what kind of field you're going into. Like the past PPI cohorts have focused on medical, have focused on economic sort of things, and also even business types of things. And as our youths, we should take initiative and step into our government and try to provide some assistance for them, because you never know what our legislature is missing out on, and we could provide the assistance that they need in the end. And this internship gave me a lot of insight on Guam's community and how they are doing, especially with meeting a bunch of different agencies and hearing a bunch of different senators talk about their beliefs. And it's just a completely amazing experience. And the speaker staff helped us out so much that we were able to complete this internship as we are today.
I would definitely recommend the PPI internship to anyone who is interested in politics, policy making, and especially just to anyone who wants to help out the community and actually make a difference. If you have any ideas on how we can make our island a better place and to better serve our people, I think this is definitely one of the ways that we could do that. Even though we're still young, even though we might not have a lot of experience, but I know that a lot of our youths do have ideas and they do have passion. And as long as you have those things, I think you'll be able to succeed in this internship.
Speaker, the last word.
Just thank you very much, Chris and Sabrina, for giving the interns the opportunity to share their case with the island of Guam, but more importantly, that this program will bring a lot of future leaders for our island of Guam. And this is where it starts. Sijus Masi, and thank you for giving us the opportunity to be with you and the island of Guam this morning.
Thank you, Speaker. Thank you, interns. Appreciate your insight, and go get them.
Yep.
Thank you.
Do you guys got to be in school? Virtual learning?
Yeah.
Okay.
Yeah, we're supposed to be in school right now.
Okay.
Oh man, so we're skipping school then. Risky. All right. Okay, guys, be safe. Wash your hands.
Thank you.
Let us know if you need an excuse note. Okay. Bye. See you, Speaker.
Thank you.
Okay, I said just right. Be safe. Stay home. 10:02.
Bad distance learning.
And they're like, "Oh, we get to skip school and go on the link. I'm in. Let's go." Bree, good job today.
Good job, Chris.
And closing takeaways from the show. Yeah, it was
hospitalizations
right.
are high, and if they continue being this high, then we are likely going to stay in PCOR 1. That's kind of like what I heard from Dr. Jana.
That was
my main
word.
takeaway.
Right. Hospital, 100% ICU, full. We also heard a story of a father whose 23-year-old daughter has tested positive for COVID-19. She's hospitalized at the Guam Memorial Hospital, and he was in line to get tested for the virus, and he made the call to get his story out. To just remind people how serious this is. He was in tears, begging our people to take this seriously.
Yep.
There's a grief talk that's being held today, 7 p.m. You can find the registration link in the comments on this stream. It'll be with Darlene Garcia, Michelle Sasamoto, and Lupi Camacho. That is at 7 p.m. tonight.
Okay.
And really quickly, shout out to all the teachers. Just wanted to, whether you're public or private school, I know you guys are working really hard. Not only having to teach our kids, but also some of you are parents too. So thank you.
There you go. Good job today, Joe, sir. Jason Solis, Ken Sanity, our guys in Master Control, and Ken Engineer. And don't forget, we got your 6 with our KUAM News primetime broadcast. Yeah. And thank you, guys.
I'll be here.
Right, okay. So this show has been proudly brought to you by First Hawaiian Bank, Calvo Enterprises, and IT&E. Of course, I want to wish a very, very happy birthday to our CEO, Marie Calvo-Monge.
Happy birthday.
It's your birthday. Get your cake and eat it too. It's 10:04.
Jason, why don't you sing happy birthday to Marie?
Yeah.
For everything is beautiful.
Hey, my name is Chris.
Mute the mic. Mute the mic.
Yes.